Navajo, Direction Sydney Sido, Kurchiri, Bashinki, on the What's so neat, I should not ask it at the little Nash. The red leading, she has a daddy. And the pre budgeted, but in it, I also the thought that's the time when you were kind of speaking low. Yado, Khaled, Yodo, the people ask for shelter when their husband or their boyfriend or someone that beats them up gets picked up by the police, but they never put the shelter or anywhere to hide them, but these people that got picked up will come back out and go to the same place again. Let's ask for what do we need to do? Do we need more funding or shelter elsewhere? So yeah, you're not that regards to this violence, family violence area. I'm sorry.
Sheila, Cecilia, Miss Sosi, could you repeat the grant contract award to Adabi?
Yes, Chairman. So that one was for $250,000. That's what was allocated to Adabi. The chair.
And he had follow-up statement, what basically, how do we get the folks out of the cycle? Because his question is, they move right back in, go back into that situation that just basically repeats. What would be your thoughts on solution?
Regina, can you answer that?
Yeah, I was going to say, this is Regina Yazzie. I can answer or attempt to answer, provide some comments on that. People, of course, we all have our own free choice as to where we're going and what we're going to do with our life. It's really people's choice in terms of going back to their home environment or being at the shelter. It's their choice, it's their right. And it is unfortunate we do have in our society today, in terms of the violence that's a continuous cycle within families and within relationships and so forth. So the recommendation here has always been that families, folks who are being abused or victims of abuse, should seek out mental health counseling and address those issues and concerns for themselves first. They need to take care of themselves first and understand the cycle of violence, understand what it is that they should be doing in terms of addressing their own issues and concerns and mental health, and getting those recommendations and assistance from a therapist, a certified therapist or counselor. That's been a long-standing recommendation for folks and people in these types of environments. But other than that, the continuous cycle of abuse and in and out of relationships, that's really their decision. There are the legal realm in terms of getting with the court on the legal side of filing a protection order, perhaps, but that's with the courts.
Chair, this is Lorena Hallwood. Could I say something, please?
Ms. Hallwood?
Okay. Yes. Eugene Yad Eshnan Ado Kodoba Bernardins Kidigi, victims, they come back many times and they're abused many times as well. And we can take this whole hour and I can talk about why women stay. There's so many reasons why women stay. A lot of times mental health is not the answer, because then there is that sort of like victim blaming and you need help. A lot of times they can't go over there because the batterers then get more aggressive and abuse the victims more, because he might blame her for, why are you going to mental health? Are you crazy? I knew you were crazy. And why are you telling them what's going on with us? So that's where this victim blaming always comes in. And we say, why do you stay? Why do you go back? It's your fault. But the question we should ask is, why does he do that? Why does he do that? There's an underlying issue where we need to also help the perpetrators and batterers. I'm not making excuses for them because I'm an advocate for victims, but there's so many reasons why women stay in this situation and why they continue to be in the cycle of violence. And here at Adabi and the other shelters, we don't say, oh, you came yesterday, we can't help you. Last week in Yana. No, if they came today, they came in last night, tomorrow, we're always going to be here to help them. Thank you.
Okay, thank you for the follow-up answer.
Chair, this is Emily Ellison with Battered Families. If I may just make a short comment.
Go ahead.
So with the state of New Mexico, they've geared towards trauma-informed services. A lot of the trauma that has happened is generational. So it is a habit that is picked up through the family setting. And a lot of these victims that do return to their abusers is based on economic situation, housing. How difficult is it to get a home site lease? How difficult is it to get a job? Mental health services are supportive in the healing process. However, it all the time comes to economics. Where are the land for homes, jobs that actually make people feel fulfilled, jobs that they enjoy doing. And so that would be a greater, the macroeconomic of how we can help stop domestic violence. Thank you.
Chair.
Oh, Cecilia?
Hey, give this to Robin. Tell her that I want to make another messenger. I want to make another messenger. I want everyone else who wants to do it.
That's Ronald Arias with Noslini School.
We're on the agenda. Report from Division of Social Services. Eugene, so brother, did you have follow-up comment?
Yeah. My first question is how much Adabi, which I got, but what I said mostly important to me is that enough? Do we need more? Where can we help? Crack it. To regards to these funding that's being given to the DHS, but it goes further back. But it's the social service could sometimes request for my presentation to what I believe in regards to the Navajo way. The next show go. I would really like to wait for you guys to give me a call. Like I know I can help because I'm abused. I was a single parent. I put out in 2000 or so. I know we can say a lot regards to education and other stuff, but there are some simple things that we kind of neglect and we kind of overlook. Okay, yeah, okay. So, but I really need to help these people that are abused to get them out of here, hide them somewhere. That would be really the question instead of letting them go back to their house and let the abuser come back again. I know the situation, everything else, yeah, but because I have my own experience too, where the person was taken away, but then she started her own life somewhere else. Yeah, I don't know if we had the money then, but the other shelters off the reservation usually take them and hide them. So I don't know how we're connected with the outside shelters. I see that this kind of nature. Those are some of the issues and those are some of the concerns I have. I would really like to have it. And how would we help? That's my question as a council delegate. Thank you.
Sheila, committee members, do you have any comments to add to this discussion?
Chair, so.
Honorable Pernell Halona.
Yes, thank you, Chair. I know, I understand this is a pretty unique situation here. What I'd like to ask is if there's any domestic training violence classes that they can offer both the abuser and the victim. And I know it's hard to get them both back to attend these things, but how can we mandate it so that the victim can be protected? I guess my first question is that with the Department of Social Services on these people that are being abused, are you advising those individuals that are being abused that do they have to file a police report in order to have the abuser to come in and to get them to take a class of abuse and neglect and to get training in that area? I know that in Farmington they had people who were abused that you had to sign up for the class and you had to take the class, but it was only for the abuser. And at that time, only the abuser was required to take the class. I don't know that we have any of those things in place here on the nation. That's one place I think I'd like to find out first. I know it's hard to get the abuser, the victim, to press charges so that their abuser can be required to come to those sessions. And sometimes that helps, and again, it's a double-edged sword. So I just was wanting to find out if there are any programs like that on the nation. Thank you.
Thank you. Ms. Yazzie or Ms. Sosi?
This is Regina Yazzie. Thank you for the chair. Thank you for the question. So regarding services for the abuser perpetrator, in terms of services, I am not specifically aware myself as to services that are specific to the training, perhaps, or mandates, as you call it, for the perpetrator. I'm not aware of that for Navajo Nation. Regarding protection orders, that's something that's entirely up to the victim themselves in terms of whether they're going to proceed with that and move forward with that. I'm not. That's up to them. However, regarding the wraparound services for families and children, yes, there is with Division of Social Service in terms of all the way from intake, assessment, providing case management service to the children and families that are that meet the assessment criteria based on the social worker that's attending to the family needs. Then moving forward in terms of referral, perhaps referral out for the family to resources such as behavioral health. Those types of resources are made available to the family in terms of referrals, and then case management, continuous case management services to the family by the caseworker.
Chair, this is Lorena Hallwood again. Could I comment?
Go ahead.
Good morning again. Going back to Eugene So's, Eugene So, identity. Yes, 200. I just speak for Adabi, but the other shelters as well. Although to me, IHS provides alternative to violence classes, a 12-week class. I think most of the shelters work with their own protection orders. Although some of them, both parties have to attend some type of counseling session. Adabi has the foundation of a new beginning, 10-week support group for the victims. The other shelters also have their own support groups. So we're trying to help the victims as well. Thank you.
Sheila?
I'd like to, if I can, explain some of the services we provide at battered families. We do have offender services, and that's a 52-week program, so that's 2 years. And we negotiated with the district attorney and the local magistrates and district judges to provide those sentences, whether it's supervised probation or parole. And we provide follow-up documentation to the parole officers for these offenders. And the curriculum that we do use is the Family Peace Initiative. And when there's some progress made, we incorporate the victim and then eventually the children. So that's definitely a service that is very strong with our organization here in McKinley County.
Okay, thank you. Ms. Yazzie and Ms. Sosi, since we do have the shelters back on this call, can you basically give us some follow-up information on risk management's requirement for certificates of insurance, naming the Navajo Nation as the certificate holder?
Mr. Chair, thank you. This is
Chair,
Regina
this is
Yazzie.
Brenda. I can answer
Go
that
ahead, Brenda.
question. Okay, I am assisting Department of Family Services regarding the contract. And as of this morning, there's 3 of them that has met the insurance minimum based off of the risk management assessment. And then the other 4, they have not met the minimum yet. So that's the update for today. Do you want me to name them, Mr. Chair?
Yes, yes, because basically you named the shelters with their contract awards, and so go ahead and go through that list again. Even on Monday's meeting, you had made that public knowledge.
Okay. The first one, Adabi, there was a third request that was sent over to risk management or this is the second review, I'm sorry, and they have not met the minimum insurance, and I will email Adobe very shortly here. Then the Northland Help Center, we're still waiting. And then the United Methodist, after the third review, they did meet the minimum insurance requirement, so that's going to be going through. And then Alice's Place, they have met the insurance requirement, so that's going to be moving forward. Kulinashe, we haven't heard anything. We haven't received anything back from them yet. So is the Roberta's Place. Then the Family Crisis, they have met the minimum requirement, so that's the one that's going is moving forward as well. So that's the 3 and the 4. They still need to work with risk management. Mr. Chair.
Okay, thank you for that update. Committee members, do you have any follow-up questions?
Chair, this is Floyd Slater. Can I proceed?
I'm sorry, I was on mute. Go ahead, Vice Chair Slater. Go ahead.
Sure. I guess this is to the program manager. Is there a plan now from DSS on how to go forward with any of the billing for services that would be provided prior to June 1st? Any progress been made in that end?
Mr. Chair, this is Regina Yazzie.
Go ahead.
Regarding invoices and payouts, those will be accepted once the contracts are fully in place. So these 3 that have met the insurance minimum, as Brenda had stated, they are going to be going forward in terms of contract setup within the system, so financial system here with the tribe. Once that's established, then yes, invoices will be received and then they will be paid out as such.
And that will only be invoicing from June 1st onward?
Yes.
Mr. Chair, this is Brenda Sosi.
Go ahead.
We are working with our Department of Justice. LaTanya, are you on the call? Mr. Chair, that's what she is looking into to see if it can be dated back to October 1st. So that was what she was researching for us. So as soon as we get notice from her, then we will let the contractors know. Mr. Chair.
This is Emily with Battered Families. If I can make a comment about the insurance.
Go ahead.
So in December, Battered Families updated our insurance policy to meet state minimums set by New Mexico CYFD and the administrators of the Victim of Violent Crime Act, which is all federal money. And they provided us limits for professional liability, which was $1 million. Our insurance policy has $1 million umbrella policy. It also has a $2 million occurrence limit. So even though the insurance wouldn't have $2 million on the professional liability, if an incident did happen, there would still be ample coverage to cover that $2 million. I've made attempts to connect with the Navajo Nation Insurance Department, Insurance Services Department on their website. They've got a number listed, 928-871-6078. And as I dialed that number, I was welcomed to the Employee Benefits Program. It's really difficult to be doing work with the Navajo Nation divisions when they seem to be on leave and we're essential services and we're providing services 24/7, 365 days a year. And these changes, again, were made mid-RFP period, and the RFP specifically said October 1st to September 30th. We're completely frustrated. We've exhausted a lot of our energy and time in responding to what should have been basic administration of federal funds. So the professional that we've been working with, we don't have the correct number. We can't get in contact with these individuals. We don't have a policy and procedures book. We've never been given these documentation ahead within a reasonable time. It doesn't seem this organization works in good faith.
I agree.
Chair?
Ms. Yazzie, Ms. Sosi?
This is Mrs. Sosi. The battered families from Gallup did not submit their RFP, so they're not included in this award. And they were closed during the time during the proposal period, so I think that's the reason why that they didn't submit their proposals. Mr. Chair?
Okay, thank you. Committee members, do you have any follow-up questions? If not, then the chair is open for a motion to accept the report.
Chair, I have one follow-up question.
Go ahead, Vice Chair Slater.
Thank you. Ms. Yazzie, I know that a week or two ago, you had held a Zoom call with the shelters, and that was at the request of the committee from several months ago. The point of that call was the point of the request was to encourage more communication and transparency and accountability on both sides so that we can really realize the potential of the program and streamline these processes that have plagued the distribution of funding in the past. And this year just completely throttled it. What is the plan right now for increasing communication so that these issues don't occur in the future? And is there anything you can point to in the near term that's going to take place that will help alleviate these issues?
Chairperson, yes.
Ms. Yazzie?
Okay. Yes, this is Regina Yazzie. We will be holding a follow-up Zoom call meeting with the vendors, the shelters, and we've not set a date, but we do plan to do that in terms of a follow-up meeting to address the June 1st or the October 1st invoicing. And moving forward, yes, we are going to be working on a more open communication in terms of perhaps Zoom meetings or phone call conferencing with the shelters themselves. There has been a lot of communication back and forth between DFS and the shelters by email. So I know those emails are going back and forth. There's communication happening in terms of submissions of documents and so forth. So our contract analyst here, she has been diligently working on this every day in terms of making that a priority for her are moving these contracts forward and getting them reviewed again a second time or third time by risk management. And of course, the communication is there with our Department of Justice as well. Mr. Chair.
Mr. Chair?
Committee members, any other comments, questions?
Mr. Chair?
Yes. Who is
Mr. Jocelyn Begay, may I add, if I may add to Mrs. Yazzi's remarks?
Yes, go ahead.
Good morning, Mr. Chair and members of the committee and shelters and other providers who are on the line. I work in the Division of Social Services and the Policy section. So I will be assisting with the division and its programs and department. I'm already working with one department on reviewing its operating policies. So I will be providing this technical assistance to the Department of Family Services. I have already made several recommendations, and one of which is to increase communication with providers, not limited to domestic violence shelter providers, but other providers it works with. And the other one is to consult with those providers on the reporting requirements, the policies and procedures that guides the division and the department for compliance with funding requirements and other requirements. The third recommendation I've already made is that we need to provide an in-service training on the RFP process, which means bringing in these other tribal departments, entities, such as, not entities, the other departments, such as the risk management, the business regulatory, OOC, their contract accounting section, and to review the provisions of the what will be going into the RFP. We will not be bringing in additional provisions that are not required. And then reviewing the contractual processes that the controller presented the other day and other Navajo Nation requirements. So, and then including the monitoring schedule, how the division will be working with these providers on the monitoring to make sure that that we work together to ensure that that they are aware of what they will be expected to, how they will be expected to submit the report. So it will, I believe, that kind of dialogue will increase communication and will be also underscore your expectation of accountability and transparency. And then also to have at least quarterly meetings or have site visits on a quarterly basis with all providers. And that, I believe, is, as indicated and moving forward, that is the commitment for the division, and as from where I sit in the policy section, that is my commitment to assist the Department of Family Services. Mr. Chair.
Thank you. Committee members, follow-up statements?
Mr. Chair? Mr. So, Chichina.
Oh, Honorable Eugene So.
Just a comment. I was wondering if all these ladies or whoever's looking, reporting, all understand Navajo. Because to social service, very important. That's really number one on the Navajo Nation, how I see it, along with the police department, to help one another. Of course, social service is number one because that's how our kids are. We need to really put down our foot and try to redo a lot of stuff regards to the Navajo Nation is the Constitution, the part way of walking, the positive way of life. You see, that's what there are because for example, RGK I think positive. Although negative, I think negative is easy. So we really need to go back to the family and re-educate them what life really means to the Navajo, which is emotional, spiritual, and physical growth, all in harmony. I'm number one as a parent. I'm not a good parent, but I am a good grandpa. Now I got a second chance. We need to compile these issues and these the cons and the whole tigi within this social service. You cannot we need to help them out where we can make them work better and give them more money to help the people out there to educate them more, not more in the Western. We need them in addition. I really back them up. So if they need funds, we need to help them out. Thank you.
Okay, Sheila, it's a committee member.
Mr. Chair? Ron Haven here.
Legislative Council, Ron Haven. Go ahead.
Just real quickly, Mr. Chair, if you can recognize me. Just real quickly, you have some individuals from the Division of Social Services, and I did hear some comments from one of the shelters there, and I just have a question, I suppose, to the division here. I understand that there have been some award notices that were actually sent out last summer. I'm just kind of curious on behalf of the committee, which shelters were given notice that they, in fact, had been awarded. I understand the RFPs were sent out as well, specifying a period of time that ran. I believe the period was provided there. I think it's October 1st to September the 30th. Now, the second question I have is with respect to the insurance. I had initially understood that the insurance coverage was always the same. And if it had been increased, when did that information surface insofar as insurance coverage having to have been increased? Is it after the award notice was sent? That's my question. I'm just curious. Thank you, Mr. Chair, for allowing me the opportunity to ask the question. Thank you.
Yes.
Great questions. Thank you, Legislative Council, Mr. Haven. Ms. Yazi Sosi.
This is Brenda, Mr. Chair. The 7 award letters that went out on May the 4th to these shelters was to Adobe, Northlands Family Help Center, Navajo United Methodist, Alice's Place, Kootenai Against Family Services, Family Abuse, Roberta's Place, and Family Crisis Center. The battered families didn't get no award because they didn't submit their proposal. So the letter did go out on May the 4th to these contracts. So that's the letter that went out on May 4th.
Now, is that this year?
Yes, May 4th, 20.
There's nothing that went out last year prior to the RFPs or any, I know the RFP, I know there's a period of time, but nothing in that period, there's no award letters or anything that went out.
The award letter that had went out, I believe that was by the previous manager, which was Virgil Pablo. And that was unofficially that went out. That was back in 2019. That was when the bed nights were included in the contract.
Okay,
that was the unofficial one that went out way back in 2019.
Okay. Behind the bar. Please watch out. Elkins Drive. Okay, I'm on Elkins right now. Oh, okay. Just come on.
Also on the insurance,
Chairman, can you remind committee members to mute their phones, please? Thank you.
Ms. Yazzie, Ms. Sosi?
Mr. Chair, Ron Haven again here.
Go ahead.
Yeah,
Mr.
real
Haven.
quickly, I apologize for asking questions here, but I have another question. You, the presenter here mentioned something about 2019. Are there any particular issues as to those award letters now? Is that some of the reasons why the shelters are having concerns over services that have in fact been provided by these shelters? Is that part of the issue here? Pay,
Yes.
active pay, that type of thing?
Mr. Haven, I guess the basic issue is the award letters went out, signed by the individual that was named. And how, the basic question is who determines whether it was official or unofficial?
Hi.
The individual that was named was basically, what was it? Division director, but hadn't been. The actual present division director hadn't been named, I think. So that's a basic question. And you're right to go to that specific item. Who determines whether it was official or unofficial? There was a signature on letterhead, and he was the designated person. Then subsequent folks that are in charge of that grant and program, are they the ones to deem it unofficial? So that's basic. I guess, okay, rather than sticking on to that, I hope that Haven. The other is there's two different, I guess, items that are before the committee. The Division of Social Services operates 2 shelters, and so far it sounds like 7 shelters are awarded. And from my seat as chair of the committee, there is the appearance of 2 different value systems that the division is requiring in carrying out these services. And for me, that's a very big concern. There's continual funding where the committee received a report that one center has not opened, but that person is on salary. So that's what I'm talking about. So in that respect, then there is certainly not the aspect of being accountable and in delivering proper services that is being required of the nonprofit domestic shelter. So that's a big concern from me, committee members. So how do we correct it? How does the Division of Social Services correct that? And then in subsequent issue, perhaps we need to hear from the two individuals that are in charge of these two Navajo Nation operated shelters. In subsequent meetings, committee members, I don't want to belabor this anymore. The chair is open for a motion to accept the report.
I'll motion, Chair. This is Delegate Slater.
Thank you, Philip, Vice Chair Slater. We have a motion on the floor. Do I have a second?
Second, Delegate Halona.
Delegate Halona seconds the motion. Any additional comments you want to make with your motion, Honorable Slater?
Thank you, Shania. I still feel that the committee has not received an adequate answer to how, with specifics, the program will address these longstanding issues. We haven't heard any sort of remorse for the situation we're in, or how structurally the program will change so that this won't occur in the future. And I think some of the updates were too vague when it comes to trying to figure out that backdating issue. And at this point, I don't know what we can expect. I appreciate the progress that has been made, but not satisfactory. So thank you.
Chair, so
Yes.
this is Delegate
Honorable
Paul.
Yes, Honorable Paul Begay. You have the floor.
Thank you. Thank you, Chair. This is kind of concerning. The one shelter that is supposedly closed, that El Card Hatnigo, and then there's the personnel still on board, supposedly working and on the clock. I think it might be good to have a report on what kind of work was being done during that time when the shelter was closed, what accomplishments were made. At Ilabana, Nishinde Lak, the shelter, that is cargo. A quite a hon now that the at and then even that she by at you, yet echotic at a had either been that Nishinde or Winston. So that is cargo, it out of an honest that on the Holland. Okay. It is out of an first case. I could say, thank you, Chair.
In that respect, then, in accepting this report, then we could ask for follow-up information and a report from the Navajo Nation operated shelters. Hotel Aliago, to Tillit, motioning parties. Would you basically include that in your motion?
Yeah, I'll consent to that.
Okay, Sheila. Shabiza, Honorable Charlene Sue, are you still on the line with us?
Oh,
Do you have any follow-up items that you would want included?
Not at this point, sir. I'm going to be looking forward to the follow-up. Again, I concur with what Delegate Slater just stated, that I feel like we haven't gotten a satisfactory answer. A lot of these discrepancies need to be answered and accounted for. So moving forward, I guess I will wait for the next. Yeah.
Okay, thank you, Shabiza. With that, could we then have a roll call vote?
Honorable Springer. Honorable Paul Begay.
Delegate Begay votes red.
Okay. Honorable Charlene So.
Red.
Honorable Carl Slater.
Red.
Honorable Pernell Helena.
I vote red.
Okay, Chair, you have 0 in favor, 4 opposed, 1 excused, and Chair not voting.
Okay, thank you, committee members. Even though unless the records show a vote of 0 in favor, 4 opposed, the chair not voting, even though the action of the committee did not accept the report, but in follow-up, these other items that we highlighted, we will require Division of Social Services to bring the personnel and the information regarding services provided and the status of the Navajo Nation operated shelters will be included on the next Health, Education, Human Services Committee agenda. Hotel committee members, thank you for the discussion that transpired on this report. Now we move to item B, report from Doltex. And the epicenter. Okay. Miss Leonora Henderson, are you on the call? Okay, let's see. Dr. Jill Jim, are you on the call? Okay, then we go to
Mr. Chair. Excuse me, Mr.
Yes.
Ramona Antonez sent a report. I emailed that out, but I don't know if she's online. I emailed that out just a while ago.
Okay. Yes, I received it. It's like Miss Ramona Antonez. Are you on the call?
Good morning, Mr. Chair. This is Ramona.
Great, thank you.
This is John McMahon. Thank you.
Thank you for respecting the committee's call to provide a report. You may proceed.
Good morning, Mr. Chair and members of the Health, Education, and Human Services Committee. My name is Ramona Antonez. I am a senior epidemiologist with the Navajo Epidemiology Center. We are housed under the Navajo Department of Health. In this COVID pandemic response, we are also housed under the Navajo Nation's Department of Health Health Command Operations Center. There is a COVID-19 operations, and under there is the Public Health branch, which I am also co-leading with Chanel Damon. And under the COVID-19 Public Health branch, we have four teams or four pillars. The first one is epidemiology, which is overseen by Del Yazzie and Dr. Terry Vaugh. The second one is the contact tracing and case management, overseen by, led by Ms. Burnett Klein and also Dr. Jill Moses. The third one is the community mitigation, co-led by Amanda Berg and also Q Anderson. The fourth one is the public health bridging, which is co-led by Lena Jocks and also Patricia Olson. I wanted to share with you that under the Navajo Epidemiology Center, we have a team of 3 epidemiologists, including myself and David Foley and Del Yazzie. We also have project manager Pimentel Francisco, and we have 2 senior programs and project specialists, including Dolores Vicente and Deidre Gray Eyes. We also have team support from Cheryl Willie, Boris Lester, and Darlene Tracy. We are all in response to the COVID-19 pandemic that is here on the nation. And we want to share with you that one of the responsibilities that we have is to develop the situational awareness report that we have been conducting just prior to our first case here on the Navajo Nation. So what we have done is we have shared with Ms. Martinez the report that we had been sharing forward on a daily basis to the Health Command Operations Center. You will see there, if you can bring up your report, this is what we will report on the epidemiological surveillance that we have seen here on Nation regarding COVID-19, the Kusintaagi-19. So this is from yesterday, dated June 23rd, 2020. At approximately 5:30, we released this report to the Health Command Operations Center. And this is situational report number 114. In there, a brief orientation. It's a 3-page abbreviated document. There are 5 total tables and then 2 figures and 1 map. We want to share with you that when you go to the Navajo Department of Health website, there's a COVID-19 page that's available. When you go there, you'll also have the number of cumulative COVID positive cases, and then also the fatalities and the mapping.
So we do want to invite you to the website as well. As we move forward, going through the report, I will report on the Navajo Nation data. This is defined as residents who live on the Navajo Nation. We also want to inform the committee that we are keeping track of the border town cases as well. Those are individuals who do not reside on the Navajo Nation in our border region and do not live on the nation, however, are receiving services at the service units such as Gallup Indian Medical Center and Winslow Indian Healthcare Corporation. So just wanted to distinguish these, what we call as incidents, which are new cases, and prevalence, which are cases that have accumulated over time. So just wanted to share that with you. As we move forward, Table 1, under the Navajo Nation COVID-19 testing, you'll see that there are 3 columns. First column has tests completed, negative tests, and positive tests. And under the positive tests, you'll see an asterisk. The asterisk says, number of positive tests may differ from total cases due to multiple tests performed on the same individual. So just wanted to bring that to your attention. We can explain that more if you would like. We can go on to the second column, which is total. And the third column, which is new in past day on June 22nd, 2020. So what we do is we collect information from the various service units, federal service units here on the Navajo Nation, by 2 methods. One is they submit through a designed Survey Monkey and also the Navajo Epi Info that is designed by the Navajo Epidemiology Center and sent out to the service units and tribal health organizations. On a daily basis, they provide information to the Epidemiology Center. The Epidemiology Center then turns around, accumulates the aggregate, and then we put it onto this reporting. And we also work with the New Mexico Department of Health, Arizona Health, and the Utah Department of Health for their confirmed cases as well as fatalities. So we just wanted to share very briefly that the information that is being collected is provided as secondary information to the Navajo Epidemiology Center. However, it is a mechanism of how we receive information. We work very closely with Navajo Area Indian Health Services. As I mentioned, I'm also co-lead with the Chanel Damon, who helps with epidemiology as well. So just wanted to share that with you as we move forward. Table 1. The total completed tests to date that we are informed of is 50,185. So this was reported an additional 741 yesterday. So we keep adding on to that total cumulative. Negative tests are at 40,160, which is reported at 256 from the previous day. So that's how we're accumulating to 40,106. When we move to the positive testings, we have an additional 43 cases, which brings us to a total of 7,088 cases cumulative. As we move to Table 2, the Navajo Nation COVID-19 confirmed positive cases, it is again a table that has the total number of COVID total cases cumulative at 7,088. Then, which has the new cases from the past day, which is 43, to add to that cumulative. As we move through the table, you'll see the COVID-19 cases by age and gender. There are 3 categories of ages that we report out. The first category is 18 and younger. We also have male and female gender. So I'm going to go through the age first, and then we'll go out the table. So for the 18 and younger, there's a total of 933 cases, which is 13% of the entire COVID-19 total cases. As we move to the next column, at 18 years to 60-year-old age category, for this category, we are at 4,535, which is approximately 64% of the total cases. The next column is 60 and older, is at 1,620, which is approximately 23% of the total cases. As I move to the last column there, you'll see that there's the male and female. The total for male is 3,363 at 47%. The female is at 3,723 cases at 53%. So you could see the age range and also the male and female. I will move to Table 3, which is the Navajo Nation COVID-19 recovery. What we've asked is for facilities to report on the number of recoveries, which is defined as discontinuation from isolation. So these persons were actually clinically defined or diagnosed, tested positive, and confirmed for COVID-19 screening and testing. So with that, we have 11 of the 12 facilities that have reported thus far, and we are at 3,754 persons who were tested positive for COVID-19 and now have recovered. As we move to Table 4, this is the Navajo Nation COVID-19 fatalities or deaths. Fortunately, when there is a pandemic, there is not only morbidity, there is also mortality. And with this, we have COVID-19 total fatalities, or persons who have passed on, at 336. And then new deaths in past day, which we're reporting, is 1. So sometimes that report there has 0, could be as 1, 2, 3, 4. I mean, it depends on how the reporting comes in from our partners. As we move to the next part of the table, you'll see the COVID-19 deaths by age and gender. We have 2 age categories, less than 60-year-old and then greater than 60-year-old. You'll also see that there are male and female. So what we want to report is the less than 60-year-old is 116 cases at 35%. The greater than 60 years old is 220 cases, which is 65%, or 2.5 times more than the younger age group. As we move to the total column, you'll see male is at a total of 197, or 59%, and female at 139 cases at or fatalities at 41%, to total the 363. We do want to share with the committee, as we do with the Health Command, that we are seeing a high percentage of male of 60 and older who have a tendency to have mortality higher than the other age groups and gender. And we have used our public health messaging, as well as our PIO, to help with the messaging at public to encourage our male older than 60 to wear masks, and also to seek medical care and look for testing sooner. I just wanted to bring that first page to your attention. Please also know that each page that we send out, we do have a disclaimer, and the disclaimer is also on this particular report out. As we move through to page 2, we have figure 1, which is the Navajo Nation COVID-19 cases by result date. And again, this is a contributions from the sources of the Navajo Epidemiology Center, the Navajo Area IHS, and the tribal health organizations, who also report into the Navajo Epidemiology Center. So you'll see that there are the number of cases, which is 0 to 300. And then when you look on the bottom axis there, it is the case report date. So I want to take you to the first. You'll see March 17, 2020, and that is the first case that we were informed of. And then you can go through the date, and you'll go through the bottom axes, and then you'll get all the way to 6/21/2020. However, when you work through that, you'll actually see 6/22/2020. And you can see that there's been the peaks and valleys on the cases as we are informed of the new cases by day. I want to bring your attention to, it looks like May 10 or May 11, right in there, that 240. It wasn't that we had 240 new cases that day. We were informed of additional cases that we did a cross-check, and we were able to see cases there on that particular day, and we helped catch up with with additional cases when we did one of our quality assurance checks. So just wanted to bring that to your attention. Typically, you could see that we've been, as mentioned, the peaks and valleys. And I want to bring you more currently. We reported out yesterday that there are 43 new cases. In the past, about, let's see if we count backwards, 7 to 10 days, we've been under 100 cases since, it looks like June 10th. Since we had another peak at 103. And then you can see we went to 92, 84, 54, 57, 22, etc. So we're really glad to see that. We want to continue to see a low number of reported new cases through this COVID-19. As I move forward to reporting figure 2, we want to orientate you that this is cumulative incidents between April 1 through June 22nd by service unit. Again, this is the collaborative between Navajo Epidemiology Center, Navajo Area IHS, the tribal health organizations. Rate per 10,000 person years is on the axes, and then the next axis is the by dates, April 1 through June 17. You can see that these are multiple epidemiological curves or cases per service unit. So the first one right up on the top there is that kind of like aqua color. You have your color available. The first line there is from Kayenta, and you can see through time how cases have been increasing. And we had a huge, not a huge jump, but we did have an increase during the May 13th time period. And then we started to equal out again. You can see that the curve is, looks like it's plateauing, and we can see that it's starting to come downward again with cases. And then as you can look at the next one, I think I'm going to take you to Tuba City, which is the next line. You could see that they've been pretty well plateaued for a number of weeks now. And they're continuing to start to decrease. And then I'm going to take you to the line that is seen as Chinle, which is which is right underneath the Kayenta curve epiline. There you can see that looks like they've had a plateau, and they're starting to go downward. Which we're glad to also see. And the next one is the Gallup. Gallup had continued increase, a steady increase of cases since May 13th, and then it starts to plateau, and you can see that we're looking like a downward, looks like it's starting to see a downward shift, and we hope it keeps going downward. And then you can see Shiprock as well. Looks like they are on a downward trend as well. We've already talked about Tuba City. Then Winslow on June, looks like in that time of June 17, you see that big step there. And I want to take you to the note. It says Jedoto was reassigned from Fort Defiance to Winslow Service Unit. That we at the Epidemiology Center, we had put them in a service unit under Fort Defiance, and it was brought to our attention that that is not the case. So we reassigned, and then because of that, you could see Fort Defiance had a slight decrease, which is the green line, and then we can just see how the cases are. And we continue to report out on the service units. And I'm going to move from this figure 2 and go on to table 5, which is the Navajo cases by service unit or tribal organization. The first column is identifying the service unit itself. The second column is the total cases. The third column is the rate per 10,000. And the fourth column is the percent change in rate over last week. And then these are total cases. They do support figure 2 as well as support map 1. And you can see there that if we were to go to, let's see, the percent change in rate over last week, for Chinle, it's minus 1.6, which means that they're starting to see a decrease from last week. And we will continue to monitor. And you could see that for the most part, cases are starting to decrease, which does make sense when we look at the cumulative figure 1 cases by day. And then we also see that there's been a slight increase, perhaps with Tuba City, and also Winslow has seen increases in cases just due to the percent change. They actually seen an increase over the past week. And this is a brief overview for Table 5. As I go to Map 1, the Navajo Nation cases by service unit or tribal organization, This is reported on June 22nd, 2020. You can see the mapping. This is what we refer to as a heat map, and this is cumulative. So what it means is that the crude rate per 10,000, if we were to have a higher level of population or compare the rate to 10,000, you could see that there's these color codes, the way the heat is from the yellow all the way up to the very red. And you could see, due to the cumulative cases here, how it looks on the Navajo Nation as a glance. And this map 1 is supported by table 5 in the cases, as well as I've already mentioned figure 2. So I also want to bring to your attention, we are looking with To'Hajiilee, Alamo, and Rama, and we put the cases all together with the Crown Point cases. So sometimes it is common in our reporting that if you went to any one of our partners, our service units, their numbers may be slightly different. There is variations between service unit and tribal health organizations because of the way we have our the definitions and how we report out. However, we are able to explain how we are assigning these cases and making the report out. I think at this time, Mr. Chair, members of the Health, Education, Human Services Committee, I would like to stop with my reporting, perhaps answer questions or share with you back. And I just want to recognize if there's members from the Health, Education, Human Services, the Navajo Epidemiology Center. I may call on the team members if they are also on the call to help me with responses if that's appropriate and necessary. Yeah, Mr. Chair.
Thank you, Ms. Antones. Committee members. Questions, statements, and then, of course, the chair is open for a motion to accept the report.
Chair, this is Delegate Slater.
Go ahead, Cecilia. Honorable Vice Chair.
Thank you. Thank you for the report, Ms. Antones. Pardon me. I guess just to start off, I have a couple questions, and I want to know, like, what can you tell us about transmission across the nation, and then also in my chapters in particular. I feel like we get these top line numbers, and there definitely is information probably from the contact tracing and all the other areas that you're collecting through to help identify what sort of transmission is taking place. Is it someone traveling, from Phoenix and coming back and infecting a family and them spreading out? Is it certain types of social gatherings that seem to persist in the face of the public health orders? I think about all of these events where there is some level of congregation, whether social distancing occurs or not, I think remains to be seen, and then might influence what people do after. But we have food distributions, we have essential supplies distributions, there's narrower hours at the chapters for doing essential or receiving essential services from them. So that includes, like the trash pickup or dumping your trash or hauling water. Are we seeing effects from any of the government closure and the public health orders? And if we are, could you help identify what those are? And then in terms of the repeat testing, how much of the data do you think that affects? And if you could just elaborate.
Hi, how are you doing
that.
this morning?
Thank you. And whoever is saying hi, how are you doing this morning? Please mute your phone.
I got a quick question. Are you at the office? could you check on Pete Cassidy Sr. and see what licensure he currently has?
Thank you, Mr. Chair, members of the Health, Education, Human Services Committee, and Honorable Slater.
Thank you. Just text me.
I might answer
I'm sorry.
Or do I hear additional comments or questions, sir?
Ms. Antoinette, will you wait for a moment, just so that
I'm sorry.
Excuse me.
Here for a minute.
Thank you.
Excuse me, can everybody make sure they're silencing their phones? Somebody who's on another call, please silence your phone.
Please don't unmute or don't mute it, because I just picked up some critical questions in that offline discussion. I'm just kidding. I think everybody's off muted now. Go ahead. It's on to Antoinette.
Thank you. I will make an attempt to answer the question and the various comments are in that one question about the transmission across Navajo Nation and the numbers that are available. We do have weekly calls, and we have frequent calls with our partners throughout the Navajo Nation, which does include both Navajo area, IHS, and federal partners, as well as the tribal health organizations and the state. They assist us with any kinds of alerts that and notifications about possible transmissions or gatherings. So just wanted to share with you that what we're understanding early on was really about household transmissions that had occurred, and we worked to improve both isolation and quarantine efforts. We also were informed that there were gatherings where there were multiple locations that gatherings had taken place. So that was also a significant place of transmission. And now what we're seeing is gatherings that are perhaps at a smaller range in size, but gatherings still continue to occur. As I keep listening to our partners, another form of transmission that we are now seeing is persons that do not live on the Navajo Nation, but are members of the nation and reside and work, go to school off the nation, and they return home. Whether they're returning home for medical care or for visiting family or for holidays. We are recently going through the process of what we know as graduation season. I mean, those are some of the activities, the holidays, etc. So we are hearing of these from our partners, and sometimes that's where one of the contributions where transmissions take place. The other is our persons, our people actually leaving the nation and going into what we also can consider the hot locations, hot spots in terms of high level of incidence of cases, such as the Valley area. And we know that COVID-19 has a community spread, which it's not always traceable exactly who and how the spread has happened. And we have to also recognize the asymptomatic transmission, where persons may be COVID positive unknowingly and can be infected and can infect others because this is a very highly infectious disease, very contagious with the droplets. And then, of course, the virus being on surfaces, frequently used surfaces, etc. So just wanted to share with you and acknowledge that there are gatherings that continue to occur, whether it's faith-based, whether it's family-based, let's see, congregations continue to occur, whether they're at a smaller scale than the larger ones. I do think that because you can see via the data, there is a slowing of the transmission, and we would like to continue to stay vigilant as not only the nation, but also the surrounding states are starting to open back up. So just wanted to share this with you. And there are other work that's being done to look at the gating and the models that are available. So just wanted to share that with you as well. As far as commenting on the food distribution and the distribution of essential supplies, I wanted to make a brief comment that we do use no contact as much as possible, as often as possible. That methodology is being used, and I would like to defer to Dr. Jim and the Incident Commander David Nez to also elaborate more on that, if that's okay with you, because there are techniques that we are using in training here when it comes to delivery. And then as part of the other comment or question within the comment within the question is the effects of government closure. With the curfew and the lockdowns, we were asked to take a look at that effect as well, and we do have some preliminary views on that, and we would like to. Well, Dr. Jim had asked the Epidemiology Center to help with that, and that's where part of the modeling and the projections on the gating is what we are working on actively to be able to support decisions or leadership to make decisions on, et cetera. So I just wanted to share with you that we are looking at the effects, and I think it's going to take us more time to see the analysis of the data that we have. So I just wanted to acknowledge your comment and your question to that, and we are looking into it, but at this time I don't have a full drafted report or a draft report to share with the committee, and we really would like to when we're able to provide better analysis on the data. The next part is about repeat testing, and to elaborate, yes, there are in the total cases, or the total testings that we reported out at 50,185. We actually do have information about possible repeats of testing. It is very well known that, or at least in the clinical perspective, it is understood that persons might come in for multiple tests. They might have come in test number 1, negative, test number 2, negative, and perhaps test number 3 is positive or negative. So there are multiple tests, and that in itself will need analysis to be able to decrease the number of testings for that one individual. But it does say there the test completed. It doesn't necessarily say the individuals were the number of individuals tested. So there are, again, some variations to that, but it's not like a high significant number where I would say, well, 10,000 of that is tested more than once. It isn't that significant. So that, of course, does have further analysis or deeper analysis that would need to be conducted. So we do acknowledge that persons do get multiple testings. We do acknowledge that some testings are not valid, or they are not, they didn't perform, like there was no result. So we don't put that into the data itself. So we keep working to clean the data. We keep working to provide the most accurate information at the time of what we understand and know of the data, and we keep listening and keep learning and keep on tabs with our partners as well as our federal partners. And I think just looking at the data in various ways. So just wanted to share that with you. I hope that might be some of the questions. I hope I answered most of them or all of them. So that would be my response at this time. And I don't know if there's any partners on Navajo Epidemiology Center team members that would like to contribute. If not, back to you, Mr. Chair, members of the Health Education Human Services Committee.
Thank you.
Chair, I have a follow-up.
Honorable Carl Slater, follow-up question.
Thank you, Chair. Thank you, Ms. Antonez. With the distributions and that sort of stuff, I guess I wasn't speaking to the no contact delivery or distribution methods, but the behaviors that might be associated with distribution. So, you know, say people come to Round Rock chapter and they're all lined up. There's only so much manpower that is available to ensure that people, you know, either are staying in their vehicles or what have you, or if they go off to the mailboxes on the other side because everyone's there all of a sudden and then they're getting out, they're coming into contact with each other, et cetera. Or, oh, I just got a meal box. I wasn't expecting this and plan kind of my schedule around it. I have extra food. Oh, I'll invite my sister and her kids over, and we'll have a little meal on Friday night. You know, that's where I am trying to get a grasp, because I see these things and I question, like, well, what's the cost benefit analysis here, and where is that being made? Because I can't do it as a legislator, you know, because I don't have any of the data and I'm not a public health official trained in this. But who is taking that into account? You know, are we crafting policies and creating a response that is doing the maximum amount to decrease our rates? Are the things that we're doing effective? You know, if we get these distributions into communities, then I would like to think presumably cases will decline, or the infection rate will decline. But even within my own communities where we've had distributions, I haven't seen it. I guess it is happening, and it's good to know. But you know, without that chapter level data, we really have no idea. And we've had that discussion before, but that's where I'm coming from, because the committee has an obligation to help define the public health response. We have an obligation to also analyze the methods of, you know, the executive branch in doing this. So you said that you're consistently reviewing the data and trying to tighten it up. Do you have any other entities that provide sort of like second opinions or supplement your resources? And what sort of resources do you need to do your job better that we could help expend or try and fast track out of HES and the council for you? we haven't gotten a lot of information really from the executive branch, and I just really appreciate you taking the time today to speak with us. So I know I have a lot of questions, but we haven't had time to talk in a while. So thank you.
Okay. Okay, have a seat. Yeah.
Sounds so nice.
Thank you. And thank you, Honorable Slater, for your clarification about what you are asking about the
There you go.
public health response.
There you go.
I just would like to request that allow me some time to do a better response to that by going back to my team and asking this question, so we can better answer that about you've shared.
I'll give you your napkin.
Wait, so is that not something that's being consistently reviewed, is kind of those metrics against at least the government's response?
Do you need to blow your nose? Do you need to blow your nose?
Whoever's talking about blowing your nose, please silence your phone.
Oh.
Show some respect to the presenters in the committee meeting.
I'm so sorry. I apologize.
Okay, so yes, I'd be glad to share with you. I just wanted to share with you that I'm not prepared to answer that question today, but I'm happy to, and look at the data and share with you more, and work with my team on that. The other is about the other entities, and we're really pleased to share with you that, we work very collaboratively with the federal facilities, which is, they have also trained epidemiologists that are on board, who are also maybe physicians or PhDs as well. They have a very good view about what epidemiology is, and they have served in that type of capacity in along their careers. So throughout the entire, I thought it just, okay. So I just wanted to share with you that there are multiple perspectives that help us with the types of data to collect and then to analyze, et cetera. Then we also have the Centers for Disease Control and Prevention here on site with us, and they are working as an epidemiological aid to multiple functions that we have here on the nation, and providing guidance and recommendations, and also support to the work that we are doing here on the nation. So just wanted to share with you that there is multiple outside entities outside of the Navajo Epidemiology Center that is supporting the work that we are doing. The situational report that we have shared to you is what we share to the Health Command. There's other not data sources, but there's other ways that we look at the data to help with the response that we may not also put onto the situational report, but we do have multiple, like various communications the week. Let's see. So we are always working to fast track and also be as responsive as we can to the methods that we are listening to our community our community partners and what they are learning from their communities, and then with the federal agencies that are here on site assisting us. So I think to answer the question, yes. To answer the question, yes, we do use other entities to supplement us here in this response, COVID-19 response. And then the need is the need for consistent support to that particular assistance. I mean, it needs to see through the pandemic. One is, and then meanwhile, we're working to also increase our capacity here too at the Navajo Epidemiology Center as well. So I think there's multiple learnings, multiple responsive plan outs that we're doing, as well as continuously monitoring our objectives to make improving not only the response, but to improve the structure from our end and providing the data needed to continuously improve the response. So I think those are my response at this time. Mr. Chair?
Thank you. Committee members, anybody else?
One quick question.
Honorable Pernell Halona.
Okay, thank you, Chair.
You could speak into the phone.
Thank you for that information on the cases. I was wanting to know, do you guys have a forecast model into the future on any on the cases that could be coming online in the next month or two? As far as the positive numbers, and I see that all the numbers they're plateaued. Most of them are coming down, but do you have any forecast models? That's my question.
Thank you, Honorable Halona. Ms. Antonez?
Thank you, Honorable Halona. We have been looking at multiple models that are available. There are many. There's not just one. And what is the best fit or the better fit for the Navajo Nation is one of the questions that I wonder about when we do look at these models. We do look at the World Health Organization, we look at CDC, we look at the state, we look at FEMA's also looking at different kinds of, they're working with us about models, and the universities, yes, I think the question that to answer the question, as you're putting it, forecast models, the way I would interpret that is the projection models or gating. Yes, we are looking at that. We haven't fully released one yet, and when we do, I'm happy to share that with you at the Health, Education, and Human Services Committee. We'll bring that to your attention. The previous predictions or the previous models that we looked at, we did predict, or we did see that there would be possibly a decrease in mid-May, but it really also depended on how our society, Navajo Nation society, had behaved. So we just wanted to share that with you, that we are looking at various models, and we'll share that with you when we have a better draft at where we're at this time. Mr. Chair?
One more quick question. I think I have, you pretty much answered my question. The only thing that I wanted to find out too was that, if you could share those models with us so that we can look a little bit into the future, and that might help to put that out there to the general public as far as the stay-at-home order, the longevity about having to do the curfew, the 57-hour curfew. Those might help if the public is aware of that, because I see some of those long forecast models for the nation and what the World Health Organization has been putting out. So, and that's what their guy using to judge the forecasting for the positive cases and as far as the uptick in the cases that are happening now. So I just that's what I was curious about. Thank you.
Committee members, any follow-up questions? If not, then questions from the chair.
Chairman Soap? Oh.
Yes.
This is Delegate Crotty. Chairman, may I ask a question, please?
Certainly you can.
Oh, yeah. Thank you, committee members and Ms. Antoinette. My question is regarding, we're seeing a lot of testing on the nation, which is wonderful. How is that all being coordinated with the nation? So I'm now seeing private testing, and so how is that being reported, or is there a procedure, or is there approval needed through Health Command for these testing sites? Thank you.
Ms. Nez, Anton Nez?
Mr. Chair and members of the committee, Honorable Crotty, thank you for your question. Yes, the Health Command Operations Center has stood up the COVID-19 branch, which is branched into the medical branch, and then there's the public health branch. Under the public health branch, there is the case management, contact tracing. And when you branch into or a little deeper into that particular branch, there is a testing coordination. We do have a collaboration with the Johns Hopkins University. They have a long-standing relationship with the Navajo Nation and the Navajo Division of Health, Navajo Department of Health, and the Navajo Human Research Review Board. So they've been here for decades, and they are assisting us in coordination with the testing. So we do have a document that we've finalized this past week, or this week actually, that had been in review. And with the leadership here, we had designed the testing to where it is required. It will become required that all testing become coordinated here on the nation. There's the documentation where not only the federal but also tribal and state and external partners, including partners, private organizations, they need to inform, they need to get approval from the Navajo Nation Health Command Operations Center to conduct testing. And if the word isn't out yet, then that's one of the charges that we have, is to make that announcement formally that these testings will need to be coordinated and approved by the Health Command, because once the registration, if you will, occurs that permits an entity to test on the nation, it does have a lot of responsibilities to it, as in how are the coordinations taking place with a local service unit, a local business, what have you. It's going to be important to understand how and who is being tested, the number of tests, so that we can also put that onto the cumulative number of testings that are being provided here on the nation. It is also important that we have a good understanding about the widespread testing, rapid case notification and isolation, and contact tracing testing and quarantine is going to be critical to slow the spread of COVID-19. It's going to be important that the coordination and we understand what types of tests are going to be conducted and the number of aim of tests and the population that is going to be targeted for the testing, et cetera. And then also, it's going to be important that if there is the reason why we want to understand the type of test is what we can anticipate the turnaround time for test results to be provided and available, and then how is it going to be reported back to the nation and the facilities and the individual, they themselves. Once that happens, if there is a positive case that is found, we need to be able to have services that are available and what that individual will do, told that their test is confirmed positive. Because what we want to do in the slowing, the deacceleration of COVID-19 spread is to ensure that they become into isolation and that education is all being supported and available for not only the individual, but the family, the household, and the community, et cetera. So I just wanted to share with you, Honorable Crotty, that yes, there is a plan in place, that there is mechanisms that are in place to support widespread testing. However, it has to be coordinated and it has to be in a controlled manner so that we can better understand the spread and also the reporting mechanisms and support to the individuals. I think that would be my response at this time. Mr. Chair?
Thank you, Ms. Antonez. Previously, during a report to Navikia Kit Committee, I had directed that the data be shared with the UNM Metals Research Group. They are affiliated with the National Institute of Health, and the Navajo Nation has a data sharing agreement with the National Institute of Health and UNM Metals Research. And I just want you to know that since I make that motion to do that, I'm going to be forwarding this report to them. The other is the New Mexico Indian Affairs Department, as well as the New Mexico Department of Health, have been conducting testing at various locations within the Eastern Navajo or the New Mexico portion of the Navajo Nation. Are those results being shared back with the epicenter to add to your data group, or is that something that New Mexico is using in their own data gathering? And are those sites also being coordinated with the epicenter? And then the other is there is a personnel announcement for contact tracers that is put out by the Indian Affairs Department. Will the Navajo Nation be coordinating with the New Mexico Department of Health regarding the work of the contact tracers? So that, and then the other is we do have clinics in the satellite, Rama, Pohajile, and Alamo. Are there testing results and positive cases and other aspects being used in your report and in the data gathering? And then on the report, you have 11 facilities, and there's one not reporting. Which facility is it? One of the independent healthcare organizations that's not reporting on a regular basis? That would be the array of my questions to you, Ms. Antonez, and perhaps to the other members of the team. Thank you.
Thank you, Mr. Chair and members of the Health, Education, Human Services Committee. Yes, there are multiple items here that I'd like to address. First of all, I want to recognize that, yes, when we reported last about the UNM and data sharing agreement with what I now better understand with National Institutes of Health, no, I have not shared data with them, and I mean them as in UNM, have not approached me directly, and they have not made a request directly in written form for that. And as I interact with that either request, I will respond accordingly. So just wanted to share that with you, that I recognize your comment or your statement to UNM. The data sharing agreement that I understood is to a different study that UNM is doing, and it's not, it may not be applicable to COVID-19 response. So I just wanted to share that with you, so I'll look forward to hearing from UNM directly. Thank you on that. The second one that was brought is the New Mexico Department of Health, New Mexico Indian Affairs. Yes, we did have conversations with the Secretary Trujillo. Madam Trujillo has worked with us here at the Navajo Epidemiology Center in response to COVID-19 and developing a team, etc. I also do know that Director Rosalind So is part of the team that's working with Navajo or New Mexico Department of Health, our Indian Affairs. So just wanted to share with you that yes, they are one of the partners. We work directly with the New Mexico Department of Health Epidemiology Center's tribal epidemiologist, partly on a daily basis or somewhat daily, maybe every other day, to receive reportings, and we have a close relationship. When it comes to testing, we are informed of the testing blitz that have occurred within the eastern part of the Navajo Nation, and the results are provided and shared with us. And just acknowledging that we do work with them closely, and yes, the numbers that the results of the testings are also provided into the situational report that we have shared today, number 114. I also know that New Mexico Department of Health works directly with service units in the region, so that channel is open. I just acknowledge that as well. As far as the coordination of the testing with the Epidemiology Center, we are well coordinated with the cases of positive persons who test positive for COVID-19, as well as the death reports. We work very closely with them, and we are informed about the testing schedules, etc. But we don't coordinate with them like the epidemiology center, that they work closely and more closely and directly with the service units. And we are informed, and the communication is open. Lines of communications are open there. So the connection that we need to continue to make is making that coordination even deeper with the testing that I provided to Honorable Crotty, so we can continue to have that communication opened. And it is there. It just needs to be continued to be communicated and informed. So I just wanted to share that with you as there's multiple testings that are occurring. The next item that I understand I heard is the personnel announcement on contact tracers and coordination. I think, if I understand the question correctly, it's the announcement that was made by New Mexico Department of Health or the governor about hiring a number of contact tracers. And yes, we are informed of that. And we do know that there was a close working relationship with the epidemiologist in the Gallup area, Gallup Indian Medical, GIMC, Gallup Indian Medical Center. And I know that New Mexico is willing to work with the Navajo Nation. And then the more coordination to all that and volunteering and assignments of New Mexico, the Department of Health hired contact tracers. There is another mechanism of protocol that would come into play. So I'll leave that to Dr. Jim to help me with answering that particular question. But I just wanted to share with you that, yes, there is a mechanism in place for assisting and to for coordination. So I'll just answer in that manner. The next is the clinic testing. The satellite clinic testing. Yes. Have our weekly calls. We have our scheduled calls in working with the satellites, Tahajali, Alamo, and Rama, and they are consistent partners in the reporting. So just wanted to share with you that, yes, for the most part, their data is collected and shared out on the situational report. So just wanted to acknowledge that as well. And I want to go back to the contact tracers. I think what you were asking about is the New Mexico personnel announcement. But I also want to share, in addition to that, is that we also are working to onboard contact tracers for contact training, contact tracing activities here on the nation as well through another partner known as COPE. And the co-leadership there is under Dr. Sonia Shin. So that public health branch continues to expand out, and we're working with them closely to, as I might have mentioned at my last reporting, to online is based on the situational report where under Table 3 in COVID-19 asterisk under number of recovery reports include 12 11 of the 12 facilities. Yes, is a federal facility here on the Navajo Nation, our critical partners, but these are also our critical partners here on Navajo. They're working directly with them, and they're very interested to start reporting recoveries. It's just some work that needs to be done to do the analyzing to be able to do the reporting. I just wanted to acknowledge and share that this facility is
Miss Antonez, we lost connection. Committee members, can you hear?
Yes.
okay. I'm here. I don't know where the connection was lost, and I don't know who I was reporting to.
So there's fingers on the line from OLS. Thank you.
Committee members, are we still connected?
Yes, I'm here, Chair.
Yes.
Good.
I'm here.
3. Okay, let's continue. So, is Dr. Jill Jim on the line? Okay. Committee members, I'm going to ask for a motion to accept the report and then to go to a roll call vote. I hate to rush the committee, but I've got to.
Eugene, so question.
Committee members, I've got to meet Mr. Manuel Rico halfway between here and Window Rock to sign the council special session where we adopted 0132-20. So I've got to certify that and sign it, and then so it can be to the president's office by 5 o'clock today. So, I beg your indulgence. So let's go do this accepting the report. We still have Kim Bakachi, Shiprock Alternative, and there's one more school. So Wide Ruins. Yes, thank you. So committee members, a motion and a second. Eugene, so.
So now this is in need. The Chile Commission, is that being decommissioned for housing positive patients? That is called. Thank you.
Ms. Antonez, do you have that information?
This is Ramona. Would you repeat the question? I heard it right.
The alternative care site at Chinle, is that being shut down? Or is that the one in Shiprock that's shut down and now Chinle is the main one?
Mr. Chair, I will need to defer that to Dr. Jim and Mr. David Nez.
Cecilia? Eugene, so. Oh. The Quaggy report, Izani report, it's with the Epidemiology Center. You see, biche naide kitndi arigi ya Health Command Operations Center. Joey Aja Dr. Jill Jim do David Nez Aja in yeta sake for equidget nizan in kitna snagi to Aja thousand. What that's the Okay, committee members.
Motion to accept the report, Chair.
Thank you, Honorable Halona. Motion to accept the report. Do I hear a second?
I will second, Chair.
Thank you, Shapisha, Honorable Charlene. So,
Chair, could I ask the motioning parties to modify the request for information from the Epidemiology Center?
Go ahead and make that request.
The request would be to follow up on the response to the effectiveness of really the Navajo Nation's response, looking at that comprehensive perspective of the food distributions, essential supplies distributions, infection rates in those communities, if there are behavior patterns that we can identify so that we can have a better understanding and have a better response for this presumable second wave that's going to happen later in the year. And then requesting the Epidemiology Center to consider what sorts of data sharing they should be soliciting instead of waiting for people to approach them. Not that that's a fault or anything, it's just an idea because the states seem to have these agreements with universities, third parties, and I think that provides A, more distribution information for our people's benefit and understanding, B, a better public health response, and C, more accountability, so we can say we are being accountable to ourselves. So I think those are my two requests. And then in terms of the coordination of testing, can we get that document as soon as possible? I'd like to see, and hopefully it'll include a historical genesis, like this is the coordination efforts that have occurred thus far, and this is how we're tightening or providing more coordination across the Navajo Nation on those efforts. I definitely don't want the Epidemiology Center or the Department of Health to be stuck at the resources they need and tackling more than they can chew. And then lastly, requesting for the needs of the Epidemiology Center as they relate to CARES Act expenditures. Thank you.
Moving parties, Honorable Halona, Honorable Charlene. So
I'm okay with it, Chair.
I approve that request, Chair.
Okay. Thank you, committee members. Otto, Miss Heather Springer, for the record, Mr. Otto So is on the call to make sure he's on the sign-in sheet as well as Honorable Eugene. So, with AILA committee members, moving parties.
This is Delegate Brown.
Oh, it's still good. Thank you. We'll move forward. Ms. Springer, roll call vote, please, on the report.
Okay.
Oh, the other. Before you go, Cezanne, Miss Antonez, Ramona Antonez, we really appreciate your attention to the details of this report, and we commend you for, going and staying with this the center through all the trials and tribulations. And we understand it can be a stressful and very demanding time. And we appreciate your dedication to that aspect. And you've been really, I guess, without no other word, that you've been forthright with the committee, with what you've presented to us, and we really appreciate that. But Ayla, go ahead, Ms. Springer. I just wanted to express that on behalf of the Health, Education, and Human Services Committee. Ms. Antoinez.
Okay. Honorable Paul Begay. Honorable Paul Begay. Okay. Honorable Charlene So.
Green.
Honorable Carl Slater.
Green, and a huge ahead to Ms. Antonez and her team and everyone over at HCOC and the Department of Health.
Honorable Pernell Helena.
Honorable Green.
And again, Honorable Paul Begay.
Paul Begay votes green.
Okay, Chair, you have 4 in favor, 0 opposed, and 1 excused. Edison Winika, and Chair not voting.
Thank you, Ms. Springer, for putting that on record. Committee members will go on to item 5C, the report on Wide Ruins Community School, Shiprock Alternative School, and Kindakachi Olcott School. Do we have Mr. Derek Franklin? Do we also have the pleasure of the new acting superintendent on the call?
Mr. Chair, this is Levita Miestas. Mr. Franklin had an emergency, so I'm stepping in on his behalf.
And do not let anybody into your house.
Okay.
Okay, because then they're contaminating your clean area.
And who will be presenting on?
All right, hon, I'll see you.
Shiprock Alternative and Kindakachi. Will it be you also?
Yes. With Shiprock, I may have the assistance of Miss Suzette Haskey, but it'd be dependent on your question. Thank you.
Okay. Okay. You may proceed with the Wide Ruins Community School.
Okay. Thank you, Mr. Chair.
And did you have a written report that you could share with the committee?
No, I don't, but I can forward after.
Okay. Thank you. Go. You may proceed.
Sure. Thank you. Regarding Wide Ruins Community School, the Navajo Nation Board of Education hearing notice is still pending due to COVID-19, awaiting listing of the executive order prior to scheduling, since the process requires witnesses. And also, Wide Ruins Community School was scheduled for reauthorization before the Navajo Nation Board of Education for consideration to continue grant status on June 11th. However, their application packet was incomplete in accordance to the Grant Contract Conversion Maintenance Handbook. The Navajo Nation Board of Education took action for 30 days with specific sanctions. The next meeting is pre-scheduled for July 10th upon the condition that their application is complete, also in accordance to the delegation of authority to the Navajo Nation Board of Education. So that's a brief follow-up in regards to Wide Ruins. I don't know if you have any additional questions.
Ms. Maes, is that the only
Yes.
part of your, okay. Committee members.
For wide rooms, yeah.
Committee members, do you have any follow-up questions on?
Yeah, I just have one question.
Yes, go ahead. Shabiza.
Thank you, Ms. May. For the report. If I may incur, what is the lacking documents as far as with this application? Thank you.
Okay, regarding the Wide Ruins Community School, let me pull that portion up really quick. One is they're lacking supporting resolutions from the chapters, which is Wide Ruins, Haibato, Hawk, and Nahadatsi, and Ganado. But however, I was given a direction that I need to reassess those applications, and if they have no ending date, to go ahead and accept. So I'll be reassessing that particular area. Then the other is a statement certified by the school board that the residential standards will be in compliance. A certification was provided, so they did fill that out. There was a number of things at the time, but however, they completed that. So the major one is the chapter resolutions. Which makes them non-compliant. And when we talk about the delegation of authority, what HESI did is they gave, rather than these reauthorizations going before HESI, they gave the delegation to the Navajo Nation Board of Education with specific instructions. For example, one, they have to be in compliance with the grant contract maintenance conversion handbook, and their specific stats required within their application packet. So our office reviews to validate that they are in compliance with each area before Board of Ed has opportunity to entertain their request. So once the application is complete, the Board of Education will entertain, and then they also have specific guidelines of looking at, they're really honing in on the finances and looking at academics. So if their finances aren't well, it's 1 year or less. If they're doing better, I guess you could say, it's 2 years. And then if they absolutely have clean audits for a duration of time, then they can be authorized for 4 years. So those are the specifics when we speak to the delegation of authority.
Follow-up questions, committee members.
Chair, I have one.
Go ahead, Shabiza, Honorable Charlene. So,
I don't know who to listen to, but this isn't the first time that I have applied for the reauthorization. But these minimum requirements and all of the requirements actually, what mean as far as moving forward? I'm satisfied of the committee's constituents in those communities do not want to support or get a resolution out because of the circumstances the school is facing. Now, moving forward, what do we do, or like, what is likely for us to, what action is going to be done now as far as with the school board? And I'm still trying to figure that out. I'm not sure if I'm saying this right, but like, you know, if they continue to apply and they don't fulfill the requirements, and, you know, this is just beginning to look bad on them. It's just like going to a car dealership and applying for credit or an auto loan, and they keep being turned down. Like, I'm still trying to understand that. So if I can get some clarification, thank you.
Thank you.
Ms. Maestas?
Yes. Okay, in regards to, in this situation, well in advance, back, I want to say it's been a year now. Going to be a year pretty soon, July. You know, the stakeholders have come forward, and the stakeholders, meaning community members and parents and grandparents, they raised some issues of concern, saying that they're not a part of planning for the schools, or they're not being heard towards educational improvement and services to the students. So what our office did is we went out and we spoke to and had several meetings, and every time we met, we told them it's very important that you involve your stakeholders in your planning. You know, you need to listen to them, you know, respect them for what they have to say. So with that, this is also a mechanism where our schools have to go before the communities and communicate. And that was a big one at the time. Go report to your communities, you know, the community, your chapters, and the various community members are curious of what's going on, or, you know, they have unanswered questions. So you need to go to the chapters and obtain a supporting resolution to continue grant status, and also work with them so that they're comfortable with services and so forth. So with that, this board have said that while we've already gone there before, so there's no need for us to go back, because there's a big issue about supporting resolutions that have end dates or specific durations within their resolutions. So right now, that's kind of their argument. But I did still classify them as incomplete, and so that's where they're at. And during on the 11th, I believe, what the Board of Education said, we're not even going to entertain them. But however, there is also a deadline of June 30th to have all the supporting resolutions coming from Board of Education submitted to BIE with the application by June 30th. There's a deadline. So to not hinder the process and so forth, the board said, okay, we're going to only extend it for 30 days with the condition that those applications are complete. And their specific sanctions is that BIE was to be provided notification that they're going to hold their July 1st funding, and thereafter their funding will be withheld on a monthly drawdown until they finalize their application. Sometimes I get in trouble because I'm really upfront with things, but I'm going to say it. We have a number of schools that it's not all of them, that will fuss over the requirements and will test you on it.
In the name of Jesus. From one corner of the fence to the other corner and back and forth all the way around.
So with that, that's where it stands right now. So until they come forth with those resolutions, I was given a task to report by to my manager by the 23rd on the status of I'm sorry, the 30th on the status of we've got 8 schools that were incomplete, and with this particular school, that was one of them. So we have up to the 30th to report of whether or not their application is complete. If it is complete, then it's going to be entertained on the 10th of July. If not, it just keeps going forward as incomplete, and there's no action. Thank you, Mr. Chair.
Thank you, Ms. Maestas. Visit, Honorable Charlene. So, as previously reported, Department of Education had previously taken control of the school, this same school, with similar issues. So it's a continuing back and forth item, and I guess the main aspect is there had been reports that the school board was meeting in person at the school, much against the of command orders. And some of the staff, I guess, feel like they've been exposed. So those are of major concern. And as you remember, the board has appeared both in person and in executive session before the committee. One of the items that we had basically implored them to do was there would be no retaliation and there would not be any harassment or intimidation. So those are some things that is of continuing concern. So so the issue still remains unresolved. So the main thing, I guess, the biggest penalty is the month-to-month drawdown. Normally, a school gets their grant monies in July for funding August to December. And then in January, they get the second half of their funding. So that is the month-to-month allocation, I guess, is the best way that the board can handle it. So it's all in the hands of the Navajo Nation Board of Education at this point in time. If there is continuing dispute and if there is continuing, I guess, not being able to do what Dodie says, the real part will then be retrocession back to the Bureau of Indian Education. That's the final straw, and that's where the committee, NAVI, and the Navajo Nation Council would act on that particular action. With AILA committee members, any questions on this particular school?
Mr. Chair, this is Maestas.
Yes.
Thank you again, Mr. Chair. I'm going to add a little bit more. This is new information that was just received within this, within an hour, I believe, is that this board held a special meeting today, and our office didn't get no notice of their meeting, and I just received an agenda, a apparently there was a couple actions that were taking place, as we're aware that they put their prior principal, they placed their previous principal on administrative leave, and then shortly turned around and terminated the individual. And that same day they took action. They brought in an interim principal, spur of the moment. So there's no knowledge of any advertisements or anything. So today there was a couple personnel actions that took place, and they hired the interim principal as a full-time principal, and then there was another position, individual held position that was holding a couple positions as a part-time business manager, human resource, and I just lost the word, a coordinator, but redid their org chart and hired that individual as full-time business manager. And that just took place, I guess, at 10 o'clock, 12 and 10 and 12 today. So right now we're looking into that matter as well, because it's new information. So we're checking to see if they followed their 24-hour meeting notice, and if they followed their policies in regards to hiring and advertising and so forth. So as we try to fix things, other things are stacking up. Shiaz?
Honorable Charlene, so.
Oh, that was what I was alluding to. I've gotten a couple of text messages regarding that meeting. And see, this is something I feel like our leadership, as well as with the board, it's not being respected. And that's what I was trying to get to, is that this is becoming overall frustrating, in that we're not able to settle this in a timely manner, it seems. And now we have other schools that are preparing. They're making preparations as far as the continuance of school, when school will begin, and what plans are going to be falling into place. And yet, this school is dealing with this manner, and a principal being hired, I suppose, not according to requirements and just by the right procedure. That's bothersome. And that's what I was getting to.
So, Mr. Chair? Thank you again, Mr. Chair. So right now, the concern is with the actions that took place by the board again, and regarding the individuals. Now they're going to argue to say, well, we signed contracts, so if any actions are going to be taken against us, you're going to have to buy us out. And it happened last year, so we had to work with an individual because of that, because they were going to lose money.
Okay, committee members. If there's no further questions, then let's go on to Shiprock Alternative School. And at the end of the reports on all three schools, then we'll do a motion to accept the report. Ms. Maestas.
Okay, thank you again, Mr. Chair. Regarding Shiprock Alternative School, from the last meeting, we were under the understanding that HESI was going to schedule a public hearing to allow the staff to speak. So so we're just kind of just awaiting when that's going to be taking place. And meantime, Ms. Haskey, she's the assigned individual to regarding SASHI. She's been in contact with the school and also participating via teleconference with school board meetings and so forth. But if you have any direct questions for Ms. Haskey, she is available.
Hi, Mr. Chair. This is Suzette Haskey. I'm on the line.
Do you have any follow-up information?
No, Mr. Chair. I have just that as previously stated, that we do have a corrective action that was set on January 14, 2020, that we still have to meet with the board and go over the CAT findings. Because of the pandemic, we haven't been able to do that. And they are aware that a public hearing will be held. We're just waiting to see what the date will be. As a reminder, FEMA is set to leave the facility, their site on July 30th or July 31st, I believe. So after that date, the school will go back to the gym, and the dorm will go back to the school. And that's the update.
Previously, it was relayed that the Board of Education never enacted board resolution to have the gymnasium and the dormitory be an alternative care site. Do you know
Correct.
who signed that agreement?
I believe it was through the name that was mentioned. It's from the BIE. I cannot remember. I'm sorry. Don't have it written down what his name was, but he's the individual that signed the document, to my understanding.
Suzette, this is Derek. I'm back on.
Yes. Oh, okay.
Mr. Chair, thank you.
Yes, sir.
I had a family emergency with my mom, so I'm back on the call now. So in regards to the facility being used regarding Shiprock Associated Schools, that agreement is actually between the BIA and the command center in terms of the facility usage. So the way I understand it is that Dr. Rina Yazzie, Dr. Janice Sloman-Chi, and the BIE work together to have that those facilities, like the facility agreement, completed and move forward. They move forward with it. So essentially, for your information, for the committee's information, the BIA is still responsible for facilities. It's not the school board. So there was some concerns from the school board in regards to the facility usage, but because the facility still belongs to the BIA, they moved forward with the facility usage agreement, and it was completed and signed. So SASI is a designated health facility site for the Shiprock area. Mr. Chair.
Okay. The other is the committee had someone shared a report that staff, some of them had non-contract renewal, and some staff, they're in the reorganization, their positions were eliminated. Do you have any information on that?
Mr. Chair, I do not have information.
I do.
Okay. Go ahead.
I'm sorry, Mr. Chair. I do. From my understanding, the non-contract renewals were based on non-renewal of certifications. That the few staff members that needed to update their certifications did not do so, or their licensures. And there were a couple of PIPs, performance improvement plans, that were not, there was no improvement. So those positions were, individuals were let go due to those situations. And it was only a few individuals from my understanding. And Mr. Chair, I did send you a list of the employees, the list that were renewed and non-renewed about 3 weeks ago.
Yes, that's the one I was referring to. Okay. Committee members, any questions? I guess the public hearing part, man, it makes it difficult. Maybe by teleconference we do a public hearing for the staff. We just have to get our schedules together. There's no other questions regarding Shiprock Alternative School. Then let's proceed to Kindahachi Olka.
Thank you, Mr. Chair. This is Levita Miestas. I'm assigned the Kindahachi Olka School. So during the last meeting, I was having connection difficulties to get on the call. So by the time I got on, we were at the section where the agenda, there was a discussion about adding Kindahachi Olka. So I didn't get to hear what the reasons were, but however, it got moved to today's meeting. So I reached out to Vince James, Honorable Vince James. I emailed him and letting him know that I'm assigned the school, therefore, to better serve, if he could share his concerns so I can look into it and provide a report. But and that email went out on Friday, June 19th. And I think your last meeting was June 17th. So I did not get a response. So it's kind of a little bit difficult to address what his concerns are without having knowledge of. But nonetheless, Kindahachi Olka was also scheduled for reauthorization and on Wednesday, June 10th. They were also scheduled, but however, they too's application was incomplete. So therefore, the board chose not to take action and just only gave a 30-day extension in regards to completing their application. And their application was lacking. Their application was lacking narrative descriptions identifying each of the programs to be offered by the school board and a description of implementation plans for each program. Also, it's required that receive certification. It's required that schools receive NCA certification, but they didn't have proof. So we've been working with Cognia's office, and information, contact information was provided to the school to make contact to obtain their certificate to validate that they're certified. Also, their reporting requirements regarding their policies did not address reporting requirements of the Single Agency Audit Act of 1984 as amended. And we also requested for validation that they're in compliance with the Navajo Nation Corporation Office with their requirements to provide annual reports there. So we were awaiting documentation to validate that. And also regarding documents, the school's scope of work that addresses program implementation and compliance to be utilized. The foundation by the independent auditing firm, which is also known as their engagement letters for school year 2019, 18, and 17, and audit reports for 2019 and 16. And so when we talk about finances, it also showed that they were non-compliant when it comes to showing clean audits within their report. So they didn't do so well within those years identified, and they had material weaknesses and significant weaknesses as well too. Ongoing communication was taking place with the principal about submitting those documents, and I also had a conference call with the principal, business manager, and the board secretary or administrative assistant, and they had said they were going to compile the documents and to amend their policy to include the requirement that they'll abide by the annual audit requirement. The board had to take action to amend their policy. So it just so happened that they had a meeting that was coming up. I think it was that coming Thursday. So to me, it was perfect timing to take care of this because it was a minor fix to get it done right away. So after their meeting, they were supposed to deliver documents to me, and I received a phone call from the principal, and the principal said that they received a directive by their board denying staff to deliver the documents, and there was an email that was sent also by their president directing their principal to contact their attorney, where there was accusations of Dodie trying to stumble their reauthorization. So that information was also received, and but meantime they've no documents were being submitted. About, I believe it was Friday. The principal telephoned me. We talked, emailed me. I called him and we talked, and he did mention that that it was an easy fix, but they're going to see what they can do to get it done. And it was also kind of a little bit disturbing to say that the board took action on non-renewal of several employees without staff's recommendation and so forth, and that this board has a tendency to micromanage. So, like I mentioned, I didn't know the full details and concerns of Honorable Vince James, so to look further into other issues if there's any. Thank you, Mr. Chair. Can you all still hear me?
Yes.
I'm here. This is Delegate, though.
Yes.
Okay, thank you. Chair, are you still on?
Mr. Chair, this is Derek Franklin. Can I add something to this?
If the chair's call is dropped, this is Vice Chair Slater, and I'll take over for the time being. Mr. Franklin, please proceed.
Yes, thank you, Vice Chair. I just want the committee to know that there are a handful of schools that really do not take this reauthorization application serious. So when my staff begin to evaluate, and we do read everything that they submit, and so when we review documents, sometimes they're outdated, and I tell my staff we are not going to accept any outdated information that schools compile within their application. Part of the requirements is that they must have everything all current. So if they submit information from school year 2019, 2020, that is unacceptable. We do not take any outdated information. During reauthorization training, it's explained to them very thoroughly, in detail, step-by-step process. So when we review these applications and they submit old data, then we don't accept it. So let me give you an example of what Levita was talking about. A narrative explaining programs that they are going to offer at each school site. For example, in the previous application, they can submit the programs that they offer, like 21st Century Grant or their math program, their reading program. So a lot of times they'll explain it, but then when they send in a new current application, it's just a copy. It's just a copy of what they submitted on the previous application. And a lot of times schools try a reading program and it's not successful, and they therefore seek a new reading program, but that's not indicated in their application. So that's why we do not accept basically carbon copies of what they offered in the previous application. So that's just an example of how thorough we review their applications, Mr. Vice Chair.
Committee members, is there further discussion at this time? Presenters, is that complete your report?
Yes, Mr. Vice Chair, that completes our report for the 3 schools.
Thank you. Committee members, if there are no questions or discussion, I'd like to ask one question. Okay.
Vice Chair, I'll make a motion
to
accept the report.
Do we have a second, committee? Delegate
Vice Chair.
Gay, hello now. Oh, there you go.
Citation Cecilia, I got ticked off the line and I'm just barely back on. But go ahead and preside, and I'll second the motion.
Ms. Martinez, I recognize the motion from Delegate So and Delegate Shirley and So, and the second from Chairman Daniel So. This is slightly unrelated, but it is related to reauthorization, and I have a request of Dodie. There is, an issue with the public health orders and the laws that have been passed that prohibit the consideration of chapter reauthorization resolutions for our BIE schools. And I received some guidance from Roderick Begay at DOJ, and he seemed open to either creating a template or trying to streamline that process to assist our chapters in schools. It seems like most schools have been able to figure it out, but I don't want anything to end up being invalid in the end. And my request is for you to coordinate or discuss with him and then report back to the committee on what you believe the best option might be going forward. If it's just coordination or if there does need to be some sort of legislative action to permit chapters to consider these sorts of resolutions, or have the committee provide some sort of reauthorization on their behalf. So that said, I will forward you the email that I received from him. I can't do that right now, and I just request that we all touch base next Wednesday at the latest.
Mr. Vice Chair, can I add something?
Yes.
This is Mr. Franklin. So one of the concerns that schools have, particularly school in Rough Rock, it's basically saying that chapters will not entertain reauthorization resolutions because they do not pertain to emergency COVID-19 issues. So the superintendent from Rough Rock did bring that to my attention. And so they believe that their supporting chapter resolutions are not going to be entertained because they are not emergency COVID-19 issues. So that is the issue for Rough Rock Community School. So they figured they're not going to have a month to submit their supporting resolutions because of this requirement that agency level agency meetings are not entertaining such resolutions per the school's request. Mr. Vice Chair.
Mr. Chair, this is May Estes. Could I add to that?
Yes, please.
Thank you. Our schools are well informed way at the beginning of the school year to start obtaining chapter resolutions from their community, because that's usually kind of always an issue because of lack of quorum or it being tabled and stuff. So we're already on them as early as October, November to say, get on their agenda now, so it gives you ample time before the deadline date of submitting your application. And we do have a number of schools that are proactive and they'll get on it. And we have some schools that, and unfortunately, I believe it's the schools that have issues within their own community. They don't want to report back to their chapters. So it prolongs, and by the time the deadline date came along for this year, it was the 16th of March. So our schools had ample time to obtain resolutions. And now, they're kind of going behind the COVID-19 issue. So I just like to share that too, that with the experiences of what's happening and what we're having to deal with now. And I appreciate you also reaching out to Mr. Roger Begay to see if they can allow our chapters to entertain this subject for our chapters. Thank you.
Can you, Ms. Maestas, can you repeat your email address?
It's Lavita, L-A-V as in Victor, I, D as in David, A, Maestas, M-A-E-S-T-A-S at nnDODE.org.
M-A-E-S-T-A-S?
Yes.
Sorry. Okay. I'm going to CC the committee members for those of you who are on the line. And Ms. Brigade does a pretty thorough and good job explaining what this issue is. I think it also extended beyond Rough Rock, Many Farms Community School. I think they require resolutions from Rough Rock and some other places. So I think we can resolve it. And I look forward to working with you both on taking care of this issue. And your point about schools getting these things done in a timely fashion is completely appreciated. And I hope that we will be able to strengthen our school boards this November. Committee members, is there any further discussion?
Vice Chair.
Delegate, is that Delegate
Vice
Brigade?
Chair. Yes, thank you, Vice Chair.
Thank you, Nelly. Please proceed.
I'm wondering, in the Rough Rock situation, where they're not honoring voting on the school board issue, or the council passed the 3-quorum legislation, and that 3-quorum legislation is strictly to address the COVID-19 issues. So if the chapter chooses not to hear this issue, the reapportionment issue, then how do we go around to have the vote, to have the chapters vote for the reapportionment issue? What do we need to do to make that work? Because the 3-quorum legislation specifically says it only addresses the COVID-19 issues. Thank you.
Shamila, I didn't quite understand the question. Is it, how does reapportionment work in this context, considering that we're going to have a lot of chapters that will need to provide resolutions when a different type of board takes effect, or?
Well, Vice Chair again, my understanding in Rough Rock chapter does not want to vote on this reapportionment because the reapportionment issue is not a COVID-19 related issue at the chapter level. Because the 3-quorum legislation.
Wait, are you saying reapportionment or the? Do you mean the reauthorization?
Oh, I'm sorry. Okay, here we go. Reauthorization. So the chapter is. I'm sorry about that. So the chapter is not wanting to hear the reauthorization or vote on the reauthorization because it's not a COVID-19 issue. So how does this voting to on the supporting resolution on reauthorization, how will that work? How do we go about getting a supporting resolution from the chapter in this case?
Okay.
If the three quorum resolution is in fact only for COVID-19 related issues. Thank you.
Thank you, Shanola. I'm going to go ahead and read from the guidance that Roderick Brigade provided. He's Assistant Attorney General in Navajo Nation DOJ Chapter Unit. Nobody should interpret this as legal advice. This is a politician reading a lawyer's writing. So, as Randali just identified, there's the COVID-19 related matters, the public health orders, and chapter budgetary matters. Those are really the three topic areas that can be addressed using the 3-quorum law. Now, under section, this is where it starts, quote, under section 3D of CAP 1920, the Division of Community Development must approve, quote unquote, additional topics that chapters intend to pass resolutions on. Beginning on the bottom of page 3 and into page 4 of the attachment, guidance was provided to chapters on the effect and coordination between CMA 0920, recently extended by the NUP Committee, and CAP 1920. The bottom line is that chapters do not need approval to consider matters on the original 3 topics. However, for any other matter that chapters want to consider, it will require approval from DCD. The goal has always been to ensure that chapters be allowed to take all necessary actions under the 3-quorum rule, but also ensure that chapters are not taking actions on items that can and should wait for consideration by the chapter membership under normal quorum requirements. So here's the process. Again, continuing, quote, basically the chapter sends the ASC SPPS, Senior Program Project Specialist, a copy of the proposed resolution or chapter agenda and requests approval from DCD for those agenda items that fall outside of the quote-unquote original 3 topics. Typically, the SPPS will obtain additional information from the chapters to support the chapter's request, and we will determine whether it is something that the chapter needs to take action on now or wait until the return of the normal quorum returns. That's not great. Okay. This is the policy now because we all don't know how long the pandemic will last, and we don't know how long it will be for the return of regular chapter quorum. So here it says, if at some point in the future the chapter needs to consider any and all topics under the 3-quorum rule, then that's something that can be discussed by all policymakers. For now, we have a system in place that hopefully addresses the needs for chapters under unprecedented pandemic. Last week, DCD and DOJ approved Lupton chapter's request to pass a resolution for reauthorization of their BIE school. In that, we received copies of several documents showing that a chapter resolution was required, and the deadline for that reauthorization was soon approaching. Having said that, if all BIE schools require chapter resolutions in their processes for reauthorization, I'm sure DCD and DOJ can acknowledge that such topics should be allowed generally and approve all of those requests from chapters. So that was the point of my request to Mr. Franklin and Ms. Maestas, was to help them substantiate that point that these schools are going to need the reauthorization, and therefore, if there could be some sort of blanket approval for them to consider these reauthorizations, maybe with a certain timeline. They can't be supporting reauthorizations for 20 years, only for 1 year or 6 months, or until a resolution can be passed by the ordinary membership. But using Doty's technical expertise and the big brain PhDs over there, they could help us figure that out. And the lawyers can translate that into something that we could legislate. And if we need to, maybe it's just something that could be authorized by the president. So I forwarded that to all the committee members and to Mr. Franklin and Ms. Maestas. So hopefully that will come in soon. But essentially for now, the chapter has to get in contact with their ASC. What provoked this was that the ASC was not actually, they had no response to the chapter. They just said, I don't even know. Like, you can't do it, but I don't even know what the process is for appealing that, which wasn't very inspiring. Committee members, is there further discussion, or can we proceed to a vote?
Vote.
Sounds like voting time. Ms. Martinez, can you please proceed to a roll call vote? Oh, sorry, Ms. Springer.
Vice Chair, this is Helena.
Oh, yes, sir.
I think we have Honorable Vince James on the line. He might be able to clear up some of that information.
Honorable James, do you have something to contribute?
Yes, can you guys hear me? This is Delegate James.
Yes, sir. Delegate James?
Okay, yes. I'm sorry. In regards to KDLO Kindahachi, I know it was brought up a concern regarding the extension of why extensions are being made for 6 months regarding the reauthorization and why this extension information wasn't being shared with school board members. The information that I got is that when the extension happens, it hinders the progress of moving forward on their end for planning for the school. And then on top of that, we're hurting the community because we can't give an answer to the community on how we're going to move forward within this pandemic. And that was the outcome of the reason why they were saying, why isn't it extension reauthorization being shared with us, and why is it being extended? So those were some of the areas that was brought up, and that, for instance, like with Kindahachi Odka, they indicated to me that their plan, they're working on the plan, they prepare the plan, and now they want to move forward with their plan. And in this case, with the extension kicking in, they can't move forward with their plan. And on top of that, they indicated to Dodi, well, we have our plan, but Dodi doesn't have a plan. And if Dodi comes in and says, da-da-da, KBLO comes back and says, well, we have a plan, where's your plan? And there's no plan set in place on how to move forward. And it's really affecting it's really affecting the school board and then the school's operation, which is affecting the community on how to move forward for the young children's education. Another one is coming from staff itself, which is again with Kindahachi Odka. Staff contracts are not being renewed in the middle of this pandemic. And those staff that their contracts that were not renewed are coming forward and saying, why are our board members in the school and why is Dodi allowing this to happen where we're in the middle of this pandemic? And then at the same time, our school had to close early. So there was really no evaluation, a proper evaluation that took place. And some of those staff contracts that were not renewed have indicated, well, this is what the principal provided me with outstanding above performance for my job duties. But somehow the principal has resigned and left, and now it's coming back to where the board is making that decision, overriding those outstanding performance that was indicated on the evaluation, but still yet our contracts were not renewed. And so there's a conflict there, and these individuals are asking, why isn't it Dodi stepping in? Or why is it the top leaders, you guys are not stepping in to put a stop to having these contracts renewed or not renewed, since we're all in this together with this pandemic happening, there should be no contract not being renewed unless it was a serious situation or a serious reason of why contracts are not being renewed. But these individuals have addressed Doty and Board of Education, asking for them to be reconsidered. And then at the same time, they also attached their employee performance evaluation forms that were done by the previous principal before the principal resigned. So they've attached all of that to the letters, and it's going before the Board of Education. They wanted me to make it known to you guys as HESI, as oversight, to know that this is what we face here at Kindahachi Odika, and this is what we're encountering, and we're community members, we're long time, we've been a long time resident of the community, we've grown up here, we've completed our education while we worked at Kindahachi Odika, and now this has happened in the middle of this pandemic. So those are some of the things that I needed to address with you guys as HESI to make that known to you guys. So that will complete my concerns, my comments, and I'm going back on mute. Thank you.
Thank you, Shiche. Doty, is there any response at this time?
Yes. Yes.
Okay.
Yes,
Mr. Vice
Mr. Chair, I can
Let
go
me
ahead
ask
and
them first,
respond to
Lavita.
those questions.
Lavita, let me respond first. Mr. Vice Chair, in terms of contract renewal, that's a separate issue from reauthorization. So contract renewals, Doty nor BIE gets involved in personnel issues. So what we do emphasize is that the school uses their own policies and procedures in terms of contract renewals and rehire. So there has been as it was indicated, that there has been a turnover in terms of administration, but now they do have a principal that we've been communicating with, and that he is aware that if there were contract renewals, they have to follow their processes in terms of how employees are to be evaluated. It is basically the governance of the school that makes these decisions for the principal to carry out. So if evaluations were not completed, typically they happen in March and April. If those evaluations were not done, then the school board makes a decision on how they're going to move forward. If within this pandemic, we've always, in letters that I've submit to ensure that they work with their staff during this pandemic. So it is, in terms of the contract renewal, that is separate from reauthorization. And on the area of chapter resolutions, what I instructed my staff is to accept all current chapter resolutions. That's what we've always done in the past. So for the case of Rough Rock, I reviewed their resolution. It does have an ending date of 2019. So therefore, I cannot accept that chapter resolution from Rough Rock chapter. That resolution, according to DOJ, they have expired. So that's why we are asking the community of Rough Rock chapter to submit a new current reauthorization chapter resolution. Go ahead, Ms. Maestas.
Thank you. Okay. The first question Mr. Honorable James expressed was, why extensions of reauthorizations of 6 months? It's not technically considered as extension. Last year, when KDLO came before Board of Education to to be considered regarding reauthorization. And according to the delegation of authority, it specifically hones in on audits. Their audit report was not a good audit. It raised a bunch of red flags. So with that, that's why they were told, correct these things were the findings that were addressed. So we're going to give you 6 months to fix it, is what they were authorized. So 6 months passed. I believe they came back somewhere, I want to say December. They came back in December, and rather than getting the back last June, rather than getting full year, they were given 6 months. When they returned in December, they were given the remaining year. So normally, even though that they're given several months, they didn't even have to. I lost my train of thought. I'm sorry. But anyway, they got their the remaining of their year. So or it ends June 30th. So for that reason, they're on the table again to resubmit their application and go before the board again. And again, their finances are being looked at. It still doesn't look very good. There's still findings and weaknesses in the federal grant and in the financial areas. So that's going to come up again. So they may be faced with that, where they're going to get anywhere from a year or less again. And insinuations of hindering progress within the school. This process does not hinder progress because you're basically, in their case, they were fully funded in July. They got their 90% in July, and then either in January they received their remaining 10%. So they have all their funds available, and they've had that. So it's business as usual when it comes to providing services to the students. And for board to say that these things aren't shared with them, it's a requirement that all board members are present when they go before Board of Education. And they are a part, as the grantee, they are supposed to be a part of completing the application. You have some boards that are very active and they know everything that went into that application because they're involved. And you've got some boards that just assign it to staff and make that directive to the staff, and the staff comply it, so that creates lack of knowledge of their own application as a grantee. And when they're told the duration of their authorization, they already hear it right there firsthand when they go before Board of Ed, and they also hear what the sanctions are and the reasons. And then it's followed up with the written, signed resolution. I'm thinking, after listening to the third one, it says they have a plan, but Doty doesn't have a plan. It's affecting services. The way I understood it, that's pertaining our schools reopening. That's correct me if I'm wrong, Honorable James. What we've been instructing our schools, yes, there's a guidance plan that's being developed by Doty, and there's a number of individuals that are involved with that. On the other hand, we're also telling our schools, all your schools have unique services. Some of you have extra support resources in your area, and some of you don't. So if you have a plan to fit your school needs and how providing services will fit your school, you're more than welcome to do it. It's what the direction we've been giving them. Meantime, there's one that's being looked at as a guidance to help our schools better prepare for reopening their schools. So we're asking our schools to be also proactive and not just twiddle your thumbs and wait for Dodie to tell you what to do. And again, for staff contracts, we step back from that. That's at the discretion of the principal and supervisors and the board. So, Mr. Franklin, I don't know if there's anything you'd like to add to what I provided also. Thank you.
Yes, Mr. Vice Chair, if I may. Please proceed, Vice Chair. Thank you again. This is Derek Franklin. So in terms of the plan that was in question, Dodie had begun 2 weeks ago developing a guidance to reopening. It is a guidance only, very much like New Mexico, Arizona. They put together a guidance following CDC guidelines. So what Dodie had done is looked at Arizona's, New Mexico's, and basically developed a guidance plan using those two plans as well as CDC guidelines, and it has been completed, and it's over at the Office of President and Vice President for approval. My understanding is that once it's approved sometime this week, hopefully by today, we will distribute the guidance to the tribally controlled schools as well as public schools, because public schools do are within the boundaries of the Navajo Nation. So that is the task that we were given, and now the guidance is now at OPVP. Mr. Vice Chair.
Thank you. Committee members, I think we need to keep moving. We're already at 2:16. Is there any further discussion? Going once, going twice, going three times.
James.
Mr. James, Delegate James.
Three. In regards to the response that I got back from the individual, it's Mr. Franklin, and who's the other individual?
Ms. Maestas.
Okay, thank you.
Is there a question there, Delegate James? Or is this just you wanted to ensure you had the correct titles and names?
I jotted down the information, and I just needed the name of who I received the response from. I have no other further questions or comments. Thank you.
Okay, thank you for joining us.
Mr. Chair?
Yes.
I think Mr. James came on kind of later. Mr. James, I did report that I sent you an email. So my information is in an email that was sent to you on June 19th.
Dang, that's a long time to not reply to an email. I'm just kidding. Okay, so
thank you.
We've exchanged our business cards. Ms. Springer, please proceed to a roll call vote.
Okay, Honorable Paul Begay.
Green.
Honorable Charlene So.
Green.
Honorable Carl Slater.
Since I'm presiding, I will not be voting.
Honorable Daniel So.
Green.
Honorable Pernell Halona.
Green.
Okay, Mr. Vice Chair, you have 4 in favor, 0 opposed, 1 excused.
Thank you, Springer. Perfect. Okay, let's move on down to item 5D, report on, quote, make COVID-19 virus non-lethal, end quote. Presenter Mr. John McMahon, co-founder of Cytokine Incorporated, and Delegate Halona is the delegate presenter. Delegate Halona, I'll defer to you, and you can identify your agent and the report.
Okay, thank you, Vice Chair. I'm not sure we're going to be able to get a report. I haven't been able to contact Mr. McMahon today yet. John, Mr. McMahon, are you on the line?
I am, Honorable Delegate. I am indeed.
Okay, great. I just hadn't been able
Beverly had contacted me.
Okay, great. Mr. McMahon, if you would, go ahead and proceed with your report on this make COVID-19 virus non-lethal. I appreciate it.
Thank you all. I appreciated the opportunity to hear the progress today and get a feel for the council, for the nation, and in particular the feedback from the epidemiological efforts. I think hopefully we have a really good follow through on that, and I look forward to this project is interesting to the council, working together with them to further understand the risks and challenges of COVID on the Navajo Nation. I had provided to Beverly Martinez this morning a set of slides. I don't know if any of the council members have seen them.
I have not received your slides yet. I don't have it in my email. This is Beverly.
Hi, Beverly. They would have come from, I can do that right now, certainly. It would have come actually from Craig Ullman. He's a colleague. He did the last review of them.
Oh, can you resend it through your email? Sometimes it goes to spam with the Navajo Nation.
Okay, so I've sending them both to you, resending them to you and to Delegate Alona. So they have just gone back out again. So without that background, I'll just walk through these slides and what we have been in discussions with. We are, unlike the efforts to track or prevent the virus, we are a group of, I'm out of the Stanford Biodesign. We have colleagues from the Mayo Clinic. Dr. Carmen Castilla may still be on the line. She's from Mount Sinai in New York City. And Dr. Benjamin Wang, who's a specialist in the immune response in patients with cancer, and particularly CAR T cells. So we're a group that's come together as a response to the COVID-19 to try and find a treatment. And the treatment is something that's existing right now and is used to treat patients that get bone marrow transplants, and they have the same risk profile. So it's an available treatment, and we're looking for a demonstration site. So we're pleased to be on the call. Our mission is to increase survival. We're not in the pharmaceutical business. We do medical device design. In biodesign as a principle is the idea to innovate, to improve outcomes and reduce costs, and therefore provide it to a broader patient population. In particular, in this brief talk, I'll be talking about inflammation as risk factors for COVID-19 patients, and I'll be talking about vitamin D, and that oftentimes one represents the other. So if you have good, high levels of vitamin D, you normally have low levels of baseline inflammation. So as I speak, I may be crossing both topics, but think of them in their relationship. In particular, unlike all the other pandemics of the last 100 years, the COVID-19, the mortality is really driven predominantly by the way it unstabilizes your own immune system. So the virus is the first domino that starts a cascade that ends up in patients getting inflammation in their lungs so they cannot breathe on their own, and then they're in quite a big predicament. So if we can address the inflammation and improve the immune system, then patients will naturally recover better. The risk factors for inflammation are completely consistent with those of the comorbidities for COVID. So that's age over 60, which we heard earlier in the epidemiological presentation is about a 3x present increased risk profile on the nation. Male gender has higher inflammation, hypertension, and cardiovascular disease are all the risk factors that elevate a patient's baseline inflammation. On the other hand, there's a need to elevate the vitamin D profile. And vitamin D deficiency also tracks with age, because if you get older, you need to increase the amount of vitamin D or increase the amount of exposure to sunlight. Vitamin D has its own, it was previously referred to as a pandemic until there was a real one, that the fact that it tracks poor diet and poverty and access to health care. And I apologize, let me turn this phone off. Stand by. Thank you. There is a natural evolution that goes into how we ingest and create vitamin D. 90% of it comes from our exposure to sunlight as creatures that lived outside. And as we've reduced our exposure to sunlight, we've also reduced it. And as a function of that, darker skin is less efficient at absorbing sunlight as well. In particular, from a Navajo Hopi Observer article, which is in the slides, studies show many Americans fail to meet the vitamin D recommendations for the National Academy of Sciences. African Americans are particularly deficient because dark skin forms vitamin D in response to sunlight more slowly. The elderly are also affected, especially those in institutions or homebound. And that's from an article from Janine Drake from the Flagstaff Medical Center. So if we look at what we're trying to provide is a treatment option from a known technology, we want to provide it where it's most needed. So the discrimination of COVID-19 is tremendous, both economically and across the access to healthcare is a fundamental. The high blood pressure is a 2.2 increase in mortality. If you have very low vitamin D, it's recently been shown that it's over 3.5 times higher mortality rate. And once again, in research done from the Navajo birth cohort study, identified pregnant Navajo women had 93% of them had very low vitamin D levels. So you've ended up with this perfect storm on the Navajo Nation that is really fundamentally driving this risk profile and the mortality. And we're interested in bringing you a treatment option that we can demonstrate and then share with the world. So what is the therapy? So phototherapy and vitamin D are related. As I said, the body gets 90% of its vitamin D from the sun. It takes it in through the lymph system into the liver and the kidneys and becomes a marker in the form of vitamin D, shows you the level and balance of the immune. The high dose phototherapy units that we're providing free of charge can give a day's worth of light in less than 5 minutes. The body uses that to balance the immune system, which reduces inflammation, increases what's known as anti-inflammation markers, and generates what's more commonly known as vitamin D. Dr. Castilla, are you still on the line by chance? Okay, it looks like she's unavailable, but she was on the call earlier. So I was going to, for her on the clinical side, so phototherapy has been saving lives for the past 20 years. It's a history of safe and effective treatment. It's basically equivalent to a standing tanning bed, but with a particular wavelength that your body is tuned to its immune system, that we've just evolved into, that we, in essence, ignore by not spending as much time outside as we previously have. It's been used in particular to treat patients that have a very similar problem than the COVID patients. And those are leukemia patients that get a bone marrow transplant. And the body is confused and unbalanced right after the bone marrow transplant. And the mortality risk of getting something known as graft versus host disease is it's about a 50% risk profile, and the mortality is over 30% of that. About 20 years ago, in clinics like the Mayo Clinic, they started using light therapy for these patients to balance the immune system at this critical time. And these are not just children with bone marrow transplants, but with adults as well. Similarly, the team that's formed at Cytokine, we've run 3 other clinical trials in light therapy here in the U.S. So we've got experience running these trials for other autoimmune diseases. Are there any questions so far?
Just a quick one on you said you had a machine or some way of infusing this light. And it takes 5 minutes?
Yes, so they're existing. So it's a common therapy. It's used in different areas of the hospital. It may be in different hospitals and clinics within the Navajo Nation right now, but people are not thinking about it in COVID. So vitamin D is known as an immune system problem, but the connection of making vitamin D and light therapy to COVID is what we're trying to accelerate. So there are existing FDA-approved, and they're in the slides, it has pictures of them, light boxes that we're having donated from a company that makes these. So we have 5 units available. They can be delivered within a week, so we can be treating patients within a week of getting a collaboration going. Each unit can treat up to 50 patients a day, 50. And the treatments, as we said, take less than 5 minutes per patient. And there's no change necessary for any of the treatment that presently exist. And the risk in light therapy is sunburn if you get too much. And the benefit that we model is 25% increased survival of folks that that walk into the clinic that are high risk, that 25% less will need to go to the ICU, and of those that go to the ICU, 25% more of those will survive. As I said, we've got Dr. Alina Bridges from the head of dermatopathology, at the Mayo Clinic, Dr. Benjamin Wang, Dr. Carmen Castilla from Mount Sinai, and Dr. Paul Yock from Stanford, all is advisors and supportive of the project. And wanted to make it a brief introduction. Hopefully that wasn't too much, or maybe we can have a conversation around how that sounds and whether that's interesting to the council.
Well, it's an interesting form of treatment. Never heard of it before. I guess it's new. I don't know anything about it. I just from what I've learned from you today.
Okay. Well, I sent you hard copies to Window Rock as well as electronic version. So you should have it hopefully in your mailbox as well now as in your electronic mailbox.
I still have not received your electronic PowerPoint. I don't know, it's not coming through.
Ms. Martinez, did you check the icebox?
It won't let me access from remote.
Oh, okay.
What is the icebox?
It's a spam filter system. Pernell, do you have Mr. McMahon's contact information? Can he forward it to you, and then you can forward it to Ms. Martinez, and the committee members can review that at a later date?
Certainly.
Yes, I
Perfect.
can.
Presiding Chair, Delegate Daniel So.
Shania, please proceed.
Oh, yeah, thank you for taking over the presiding chair. And I didn't catch the presenter's name.
John McMahon, sir.
Again? Could you repeat it one more time?
Oh, sorry. John McMahon, MacMahon.
Okay, Mr. McMahon. Have you also looked at the correlation with zinc? I know that as far as
we're not drawing blood on them so far. We've done it for 6 people around the country, and they're all fine. Only one had super high risk profiles, late 80s, previous heart surgery, diabetic, and he came through with flying colors. So we're looking to partner with the group where it's most critical, where we could have the highest level of science. And in essence, we could really lead an opportunity, because there are these units around the world in dermatology centers and leukemia centers, and we would just be helping those units move to the ICUs to start treating patients.
Chair, can I ask a question?
Sure.
Chair.
Delegate So, please proceed.
Thank you. Okay, so you explained the risk factors as far as with elders over the age of 80. What about as far as infants? What are the risk factors with that? And what about the cost? Can you elaborate on that? Thank you.
Certainly. So the risk factors, the CDC was spoken about today. The CDC can list the risk factors, and there's publications daily about how well we're defining who walks in the door as the highest risk to end up on a ventilator. Hypertension is the highest, of course, and then age over 60, and it steeply goes up. Infants, pregnant women, they're really not having a huge mortality risk at all. It's no different in pregnant women than it is with women of the same age. And for example, MERS and SARS, almost 50% of MERS deaths were pregnant women. It's a little. The reason that pregnant women are susceptible to viruses, where the virus is really the problem and not their immune response, is the fetus is considered to be a foreign object, and the body naturally reduces its own immune response to not reject the fetus. And so if they get a really tough virus, they're really at risk. So all of the previous pandemics have been particularly harsh on pregnant women. And that's just not the case at all. Also, with patients that have transplant patients that are elderly are not at super high risk, even though they're taking immune suppressants because they have a new lung or a new liver and new kidney. The problem, if we're really going to try and take our loved ones that get exposed to COVID and do something for them, we have to answer this question of how to control their own immune response. And that's what we're working on. The cost-wise, so Dr. Fauci and Dr. Birx cut the cost in half for the trial, because they stated that anybody that's doing research and blood tests, that those will be completely reimbursed by CMS, the Center for Medicaid Services, and that was $1.5 million of the $3 million to run a full trial. I don't know the density of the patients. Earl Tully and I spoke about it, and I've been reading up, just trying to see what's the highest density of patients you have, whether it's the Indian Medical Center in Gallup. So we would think it'd be a smaller study. We would train your healthcare workers in the system, which is one of the predominant costs. And this other company is donating the lights. So, we think if we can figure out how many patients you need, how many patients are what we call aggregated in one location. I think today they said you had 57 new patients test positive in the earlier discussion. And we want to randomize those. So you'd take half of those patients and treat them. If we do 300 patients, it's about $1.25 million total for the study. And if we can but I don't know if you have 300 patients in one location. So if the trial's of interest, we think we can get a public-private partnership to help pay for it. But I wanted to introduce you to the technology, and then if it's interesting, we can find out how many patients you have in one location, and we can start, getting into the logistics of how we might actually run the trial. So it's a standing unit about the size of it's about 6 feet tall. It's on wheels. You put it in front of the patient. They get treated. You go to the next patient, or if the patients are ambulatory, they walk up to it. They get treated. They get treated again the next day for up to 10 days, and then you really elevated their immune system and their blood chemistry at that point. So it's nothing like a drug trial. It's no expenses like that. It's the biggest activity would be we really want to have the highest level of clinical rigor. So we want to randomize patients, and we want to do before and after blood tests, which now the government will pay for all blood testing in COVID-19 research.
Okay, committee members, any further questions?
How about this? Do we talk with Dr. Jill and see if she would want to try some of this? Some of the patients here on the reservation?
Yeah, Delegate Helona, do you want to motion to accept? Oh, I guess. Yeah, no, you can motion to accept. Motion to accept the report and then identify some next steps, like speaking with Dr. Jim or Area Director So. The healthcare providers really need to be the ones who are integrated in the conversation. So to me, that seems like the next step, and see if you can get a second based off of what you'd like to identify.
Presiding Chair Daniel, so I'll make that motion.
I will go ahead and second. Thank you.
To proceed for our group to meet with Area Director Rosalind So and Dr. Jill Jim and the powers that be to get these trials going.
Okay, I'll recognize that motion from the team So Squared, Shania, and Delegate Charlene So. Can everyone make sure their phones are muted? Somebody's yelling, maybe at their mother. I can't tell, but I don't want to know, so please mute your phones. Committee members, I'm not hearing any further discussion. Shall we proceed to the vote?
Delegate Slater, this is Delegate Brown. I have a question, if I may, after the committee.
Yes, Delegate Brown, please ask your question.
Thank you. Shananta, Adult Health Education Human Services Committee, honorable delegates, thank you. And thank you to the presenter. It was a very a great discussion. Thank you for bringing this to the HES committee. I don't know what the process would be, and I think I would rely on Dr. Jill Jim and the area director, Ms. Rosen. So I'm really interested. I don't know what the process would be, but again, as the hardest hit IHS on the nation, if the nation proceeds, I would like to see this through and how we can collaborate with this organization and these doctors, the professionals, because a lot of our people are, they're immune compromised due to diabetes and other health issues. And that's why our numbers are so high on Navajo. We're losing our people because of compromised immune systems. I would be really interested in Shema, when you get the the presentation PowerPoint, can you also send it to me? And I would like to share it with my people. Really, I've been taking my vitamin D, and then vitamin C is essential according to the doctors during this time. And I've been telling my whole constituents, buy vitamin C, buy vitamin C. Don't buy any more sodas or flour because that's a lot of carbs. But anyways, I'm trying to find every way that I can to continue to combat COVID, to save our people. But I'm really interested to see what the process is and how can we get this to not just KN's IHS, but all the IHSs. If this will in fact boost our immune system. And I say this also, my colleagues, is we do know we can literally just look at our people's Facebook, Instagram, Snapchat pictures, and you'll see, and I hope I don't offend anyone and our relatives, that whoever cooks their meals, is you have a really good, healthy serving of stew, and the next to it is usually, there's a lot of potatoes in it, and next to it is usually a can of soda, and then they have ice cream or something for dessert. And then like breakfast burritos is very popular amongst our people also, which has a lot of carbs. And just with that, if we can think about with the HES committee, having this very important charge that you have and the authority that HES has, and really relaying this. Basically, it's life-saving information right now for our people. Thank you for the presentation, and I would like to see how we can support these initiatives. And to really, I think with the COVID relief funding, the CARES Act funding that's coming, we really need to invest in our people's health. And that means when I'm making deliveries, no contact deliveries, I often ask my elders, are you taking vitamins? And they always say, doctor, and that's what they usually say, our elders, is they really, and I think we as children and grandchildren need to start educating them. And I buy even my nieces and nephews, I notice that my brothers and sisters actually don't buy their children vitamins. And then seeing that the frequency in that is pretty high amongst our people, that we are not taking these very important life-saving vitamins. So thank you, Vice Chair and HES committee for allowing me to speak. Go ahead.
Thank you, Delegate Brown, for your comments. I don't think there was a question, just a request in there, and you can help facilitate that request. Springer, can you go to? Oh, sorry. Is that Delegate Halona?
Yeah, I would like to go ahead and just proceed with the vote, and then take it to the health department and Robin So and see what we can do with it. Then how we can get this test, have it brought to the Navajo Nation and do a test on it and see if we can have any success with it, because right now there are really no cures for that COVID disease or virus right now. So this seems like it would help to slow down some of the fatalities and strengthen up some of the people that have this virus. Okay.
Sounds excellent. Let's proceed with the vote. Thank you, Delegate Halona, for bringing this presentation to us.
Aye.
Okay, Honorable Paul Begay.
I'm like,
Honorable Paul Begay.
Green.
Honorable Charlene So. Okay, Honorable Paul Begay.
Green.
Okay, Honorable Charlene So, green. Honorable Daniel So.
I vote green.
Okay. Honorable Purnell Halona.
Halona votes green.
Okay, Vice Chair, that's 4 in favor, 0 opposed, and 1 excused, Edison Winika, and Vice Chair not voting.
Thank you, Ms. Springer. Thank you, Delegates Brown and thank you, Delegate Brown, for joining us and asking a question and participating. I'd like to move on to the next item on the agenda. So this is 6, old business, item A. I don't believe we deleted this, correct? We just ended up leaving it on there. Shouldn't I?
Real quick, Chair, Vice Chair.
Yes.
Mr. McMahon, are you still online?
Presiding Chair, Cecilia Carl Slater.
Yes.
A question to Ms. Martinez. It was tabled, and do we have to do a motion to recall it, or do we just make another motion to table? And that would essentially be the end of that legislation, as had been recommended by Legislative Counsel Ron Haven.
Mr. Chair, June 10th, the recall motion was by Auditor Pernell Helona and seconded by Paul Begay Jr. And we lost quorum right during when we recalled for the vote, so there was no recall motion.
Respect to some amendments supposed to have been incorporated. Now we just simply we don't have a sponsor now. I explained some of the options. One is just simply to take it off the agenda, but nonetheless,